Okay, so welcome everyone to the 72nd lecture of Dr. Haji Step 1. Before we begin, can we ask you guys whether you guys can hear my voice? Yes or no? Okay, perfect. Thank you so much for making it to today's lecture. Hope you guys are all doing well. Did you guys have a chance to complete your homework from yesterday? Did everyone complete their homework from yesterday from microbiology? Can you guys hear my voice? Okay, how about the rest of you guys? How about Dr. Allison, Dr. Hossam, Dr. Jordan, Dr. Uday, Dr. Khatun, Dr. Hassan? How about you guys? Okay, good. Okay. Thank you so much for uploading the equations page, which we asked you to. Thank you so much for doing that. And I also saw that you guys did it under wonderful timing, so that's very good. That this will really motivate a lot of the other students to do the same thing too. The reason being is because we want you guys to do this at the beginning of the exam so that you guys have all your equations ready. And when you solve the equations, when you get questions, you can easily answer those questions. Yes, you were motivated by the others. Exactly. That's what I have been telling you guys. If you guys, if one person does it, the another one can see and get motivated to do it too. So that's the reason. So thank you so much for completing it, Dr. Hassan, Dr. Adonal, Dr. Jordan, and we will choose two other students to do the same from today. Okay. So having said that, shall we begin our revision to see if we have learned all the bacteria we did yesterday? Yes or no? Is everyone ready? Is everyone ready? Okay. Would you guys be willing to do the revision at the end of the lecture so that we can start with the first aid right now, or do you guys want to do the revision first and then begin? Everyone else? Okay. Then we can do the revision of bacteriology as a whole, gram positives and gram negatives. Okay, so let's get done with gram negative bacteria and we can do the revision after the end of the lecture. Okay, so make sure that we finish on time so we can do. Okay, so can you guys hear my voice and see my screen? Just making sure. Can everyone see my screen and hear my voice? Okay, good. Okay, so let's begin. We studied till Haemophilus influenza and Acinetobacter baumannii yesterday. And from right now, what we are going to do is we are going to begin with Bordetella pertussis. First and foremost, Bordetella pertussis. I'm going to ask you again, what is the disease that is caused by Bordetella pertussis? Which disease is caused by Bordetella pertussis? Whooping cough. Very good. Okay. Now, Bordetella pertussis, is it a gram-positive or a gram-negative bacteria? Fast answers, please. Is it a gram-positive or is it a gram-negative bacteria? It's a gram-negative bacteria, meaning that when you stain the bacteria with gram stain, it appears pink. And if it's a gram-negative bacteria, we know that how many shapes are we supposed to see are there in gram-negative bacteria? How many shapes are there? Fast answers, please. There are three shapes. There are four shapes. Four shapes: diplococci, coccobacilli, curved and curved rods, and bacilli. Okay. So Bordetella pertussis, under which shape does Bordetella pertussis fall? What is the shape of Bordetella pertussis? Coccobacilli. Okay, good, very good. And if you were not sure that it's a coccobacilli, and if you thought that this was a curved rod, which test would you do to confirm if it's a curved rod or not? Which test would you do? Oxidase test. Okay, good, very good. Okay, so Bordetella pertussis, is it an Arabic or an anaerobic bacteria? Is it an Arabic or an anaerobic bacteria? Okay, so it's an Arabic bacteria. What are the names of other Arabic bacteria? What other Arabic bacteria are there? Fast answers, please. I need some fast answers from you guys. What other Arabic bacteria are there? P chunk is for urease, positive. There is nocardia. Then Clostridium is not Arabic. Dr. Hassam, I'm sure you know Clostridium is not Arabic, right? Pseudomonas, okay, that's nocardia, mycobacteria, Pseudomonas, and Bordetella. Okay, yeah, I just woke up. Okay, so if you just woke up, okay, take a second, and then okay, good. The stay is also there. Okay, good. So let's begin. So first of all, we're going to talk about Bordetella pertussis. It's a gram-negative Arabic coccobacilli. The virulence factors includes pertussis toxin. What is the mechanism of action of pertussis toxin? What is the mechanism of action of pertussis toxin? Elongation factor 2 is not the correct answer. Inhibition of GI results in increased CAMP. As a result, does this increase fluid secretion or inhibit phagocytic ability? Dr. Jordan has already answered. It's inhibition of phagocytic ability. Very good. So, very good. So it's a gram-negative Arabic coccobacilli. Virulence factors includes pertussis toxins that will disable GI. Adenylate cyclic toxin will increase. That is, CAMP will be high, and tracheal cytotoxin is also there. There are three clinical stages. That is, you have catarrhal, paroxysmal, and convalescent stage. Okay. First of all, in any catarrhal stage, you have low-grade fevers and coryza. By the word coryza, that means um, when you have nose snifflings, right, and secretions, that's known as coryza. Then paroxysmal stage is a period of intense cough followed by an inspiratory whoop. It's followed by an inspiratory whoop. That's why it's called a whooping cough. And the cough is so severe that the patients, they have vomiting after the cough. Convalescent stage is the gradual recovery from the chronic cough, and that's the convalescent stage. Okay. For this one, the only high yield is the identification. Okay, the only high yield is the identification, and the highest yield is the mechanism of action of the pertussis toxin. So your questions will come from over here. That is the clinical features. They will tell you that you have a young patient who may not have been vaccinated, or his or her parents believe that vaccinating children is unethical, and that's that. And what would happen is these children, out of nowhere, they will have low-grade fevers, cough, and um, excessive coughing, resulting in post-tussive vomiting. This is known as whooping cough. So the identification: what is the organism that is responsible? The organism is Bordetella, and you have to identify it from over here, gram-negative. And the virulence factor, they can ask you about the mechanism of action of pertussis toxin. That's that. It's prevented by Tdap, that is tetanus, diphtheria, right? Or DTaP, or diphtheria, tetanus, pertussis. So either that, it may be mistaken as a viral infection due to lymphocytic infiltrate from immune response. So this is another bacterial organism. Which stimulates lymphocytes rather than neutrophils. So that's that. What was the name of another bacteria which increased the lymphocyte count in the CSF instead of? Very good. That was Listeria. So don't forget that. Treatment is with macrolides, Bordetella. Okay, and if allergic, we can use TMP SMX. TMP SMX is trimethoprim and sulfamethoxazole, but macrolides are number one. Okay, so with this, what you can do, have you guys heard of the burger Big Mac? Yes or no? Has anyone had Big Mac? I used to love having them. Then I got really bored of them, and I haven't had for the last 1 year. Big Macs, absolutely horrible, but tastes amazing. I mean, it's horrible for your health, but it tastes amazing. So Big Mac, the word Big Mac is Bordetella, can be treated with macrolides. So Big Mac, please write this down over here so that you don't forget, because the treatment is also sort of high yield. Okay, okay. Are we clear about Bordetella? Let's move on to Brucella. Let's move on to Brucella. Okay, once again, Brucella, gram positive or gram negative? Gram positive or gram negative? Gram negative. If it's gram negative, what is the shape we're looking for? What is the shape of Brucella? Coccobacilli. Okay, good. Very good. Is it Arabic or anaerobic? It's Arabic. Okay. Okay. Have you guys heard of Bruce Wayne as being the Batman? Yes or no? Bruce Wayne as the Batman? If you have not heard it, I'm pretty sure if you have children, then they should be obsessed with Batman. And Batman is basically a comical character displayed by a guy whose name is Bruce Wayne. Okay. If I tell you Bruce Wayne is a big fan of having mac and cheese, please remember this for at least the fact, at least for doing well in your exam. Remember, Bruce Wayne loves to eat. Write this down. Bruce Wayne. This is the only thing that's important from Brucella. That is, Bruce Wayne loves to eat mac and cheese. Mac and cheese means macaroni and cheese. The reason I want you to focus on the word mac, that's because this organism is the only organism which will survive in the macrophage. Okay, this is an organism which will only survive in the macrophage. Over here, this is an intracellular organism. And this is an intracellular. It's not obligatively intracellular. It's a facultative intracellular. So it's an intracellular organism which loves to stay inside this cell over here. That is the macrophage in the reticuloendothelial cells. And in USMLE step 1, in order to make some very difficult questions to separate the students from 220s to 230s and 230s to 240s, they will ask you, what is the name of this organism which thrives inside the macrophage? And if it's a bacterial organism, they will tell you that, they will give you a hint that this organism is gram-negative, as an Arabic Coccobacilli. It thrives inside the macrophage. What is the name of this organism? It's Brucella or brucellosis. Brucella is transmitted via ingestion of contaminated animal products, especially unpasteurized milk. So there's not a lot of brucella cases that you will see in your practice, because most of the stuff that people get over here are from the groceries, and they have an expired product, and they do not sell unexpired stuffs. But this is more common in places where where they get their food, especially directly from the farms. So over here, it's not that common in big cities, but outside of the cities, it's not very uncommon. The reason is this is transmitted via contaminated animal product, and the sign symptoms are very similar to tuberculosis, except that over here, patients they do not have a cough. Instead of cough, what they have is they have arthalgia. So they have fever, night sweats, and arthalgia instead of having fever, night sweats, and cough. Okay, fever, night sweats, and cough. Now, um, and so Bruce Wayne loves to eat mac and cheese. Will help you realize that Brucella will survive in mac and cheese. Okay, and Bruce Wayne. If I tell you that Bruce Wayne also drives a cycle, is that something that you guys would have a very hard time remembering? Bruce Wayne driving or driving a bicycle, riding a bicycle. Okay. So Bruce Wayne loves to eat mac and cheese and Ride, write this down over here. Bruce Wayne loves to eat mac and cheese and rides bicycles. Bicycle. Cycle. The reason I want you to focus, the reason why I made you read this one is because I want you to focus on the word cycle. It's because the treatment is very high yield. Cycle for doxycycline. Okay, doxycycline. Plus, we can give rifampin or streptomycin, but doxycycline is number one. The treatment is very high yield for brucella, and doxycycline plus rifampin or streptomycin. That's that. Okay. The doxycycline is there, then we have rifampin or streptomycin. Okay. How important or which bacteria is very easy to remember, Staphylococcus aureus or brucella? Staphylococcus aureus or brucella? Which one is which one is more easy to remember? Brucella is easy to remember. Staph aureus is easy to remember. Okay. I feel like a lot of students will remember Staphylococcus aureus because it's more common. Okay. But the thing is, USMLE step one will try to test the students with brucella to separate the students with good scores to the best scores. So something like that. So if you cannot remember this, you will not do bad in your exam. But if you can remember this, there's a high possibility you will do really well. Okay, so that's it. Now, you saw a case of brucella in the hospital. Okay, I have never seen a case of brucella in the hospital as of yet. So that's very good to know. Okay, good, great. Let's move on to Legionella. Okay, let's move on to Legionella. Okay. Oh, good. You saw your case of brucella in the hospital in your country. Okay, that's very good to know. Good. Okay. Let's begin with Legionella. Is it a gram-positive or gram-negative bacteria? I need some fast answers, please. Gram-positives or gram-negative? It's gram-negative. Well, what is the shape of brucella? I mean, Legionella? If it's gram-negative. Gram-negative. If it's gram-negative, what is the shape of brucella? Coccobacilli. Are you guys sure it's Coccobacilli? Legionella. Everyone, can I get some active participations from you guys, please? Okay. Can everyone hear my voice? What is the shape of the organism? What is the shape of the organism Legionella? The shape of the organism Legionella, okay, Legionella is a rod-shaped organism. It's a bacilli. It's not there on the table, okay? It's not there on the table. So over there, so it's not very fair for me to ask if you guys know the shape or not. So even if you guys don't, that's not a problem. Just remember that this is out of the table, but it's a gram-negative rod. Okay, it will gram stain poorly. So since it gram stains poorly, that's why they did not really mention it on the table. That's that. But we studied the agar where we culture Legionella. What is the name of the growth media where we culture Legionella? Fast answers, please. Charcoal yeast agar with what? Charcoal yeast agar with cysteine and iron. Very good. Okay, charcoal yeast agar with cysteine and iron. I need you guys to participate at the same time, please, to make sure that you guys are all listening to the lecture. Okay, please try to participate. If you do not know an answer, please let me know that I do not know an answer. At least I know you're there. Okay, so Legionella is basically, it's a gram-negative rod. It will gram stain poorly, and it's cultured at charcoal yeast agar with cysteine and iron. The most common question that you will get from over here is that people with Legionella, they have pneumonia. So Legionella is very important for causing pneumonia from water source, from a source of water. Okay, from a water source. So basically, this will be pneumonia along with diarrhea. If you get questions with pneumonia and diarrhea together, please think about Legionella. Okay, USMLE step 1 will help you identify Legionella by telling you that you have a patient who has pneumonia and diarrhea together. Okay, pneumonia and diarrhea together. Pneumonia and diarrhea together, the highest possibility, the bacteria they're talking about, or the vignette is talking about, is Legionella. Okay, so write this down: pneumonia from water source and diarrhea. The water source is basically aerosol transmission from environmental water source habitat, or air conditioning, meaning poor air conditioning or venting system. So there's a possibility that if one person is affected, the entire ward in the hospital can get affected. So that's that. And Legionella will cause Legionnaire's disease. Legionnaire's disease is basically pneumonia, diarrhea, along with fever is obviously there because it's a bacterial infection. And people also have some CNS symptoms. CNS symptoms, they can get delirious, they can get mild seizures, and that's that. Okay, this is very common in smokers, and in chronic lung diseases, it's very common. So the thing is, over here, if you can see that this is the CT scan, in the CT scan, you can see there's one lobe of the lung that is affected. So Legionella, it causes lobar pneumonia. So that causes severe lobar pneumonia and diarrhea together. So pneumonia and diarrhea together, you are dealing with Legionella. Okay. So things to remember from over here is the shape. It's a gram-negative rod. That's number 1. Legionella is very high yield, so I'm going to give 2 stars over here. The culture medium is very high yield. That is charcoal yeast agar with iron and cysteine. That's very high yield. The source is very important. That is from a water source. That is aerosol transmission. And what it causes, it causes Legionnaire disease. That is pneumonia and diarrhea together. Okay. So that's that. And the treatment is not that high yield, but what we treated with macrolides. Okay, we treated with macrolides. It's not that high yield. They don't really ask you a lot about the treatment, so don't worry about that. Okay. Okay. Can we move on to Pseudomonas? Is everyone hearing my lecture? Can you guys hear my voice? Are we ready to begin Pseudomonas? Okay. Okay. Yes, we discussed the picture. This is just a picture of lobar pneumonia, as is okay. This is a CT scan of a lung showing lobar pneumonia. Okay. Next one. Let's move on to the next one. That is Pseudomonas. Pseudomonas, once again, gram-positive or gram-negative. Fast answers, please. Gram-negative. If it's gram-negative, what is the shape of Pseudomonas? It's a rod shape. If it's a rod shape, if it's a bacillus shape, what is the next test we do to differentiate the organisms? That is gram-negative bacilli. Lactose fermentation. Very good. We do lactose fermentation first. If it's lactose fermenting and if it's a fast fermenter, which 2 organisms are we talking about? Fast answers, please. E. coli and Enterococcus is not gram-negative. E. coli, and Klebsiella. Okay. If it's a slow lactose fermenter, which two organisms are we talking about? Citrobacter and Serratia. If it's not lactose fermenting, then we do the oxidase test. If it's oxidase positive, then which organism are we talking about? If it's non-lactose fermenting but oxidase positive, which organism are we talking about? Pseudomonas. Okay, so can we assume that Pseudomonas is gram-negative Arabic, bacilli, non-lactose fermenting, oxidase positive, right? Oxidase positive. Yes or no? Along with this, Pseudomonas, is it also catalase positive? Catalase positive. Do you guys remember the chronic granulomatous disease where we learned 5 or 6 catalase positive bacteria over there? I'm not sure, but I think they mentioned Pseudomonas. Pseudomonas is a catalase positive, so it's an Arabic motile catalase positive gram-negative rod. So non-lactose fermenting, but it's oxidase positive. It's frequently found in water, has a grape-like odor. It has a grape-like odor. Okay. Pseudomonas. Pseudomonas is associated. Pseudomonas infection, first and foremost, I just want to point it out. Pseudomonas infection is very high yield for diabetic patients, especially diabetic ketoacidosis and diabetes mellitus as a whole. It's also responsible. So write down your like underline this one with a bit more emphasis on diabetes because this is more high yield. And we also know that Pseudomonas will cause pneumonia, sepsis. It causes another disease known as ecthyma gangrenosum. That is a dermatological disease. Okay, ecthyma gangrenosum is something like this one, which is a rapidly progressive necrotic cutaneous lesion. It's a cutaneous lesion. They don't really test ecthyma gangrenosum a lot because this picture over here is not very indicative of a Pseudomonas infection. Pseudomonas is not the first thing you will think about when you look at this picture. So they don't put a lot of emphasis on this, but they do put a lot of emphasis on the fact that diabetic patients has a higher chance of having Pseudomonas infection. And another one is mucoid polysaccharide capsule is also there. So mucoid polysaccharide capsule. It can also cause otitis externa. That is another one. That is, they can cause otitis externa malignancy or otitis externa maligna. That's what they can cause. So that is also high yield. Okay, and nosocomial infections also there. They are very common. They're very common in drug addicts. That is, drug abusers and skin infections. If you have patients with skin infection, that is hot tub folliculitis. This is also high yield and highly tested. Hot tub folliculitis. They will tell you that you have a patient who has boils and blisters and or some sort of a carbuncle or folliculitis like presentation with a history of using the hotel's hot tub. And a lot of students will think about Staphylococcus aureus, but the bacteria I want you to think about is Pseudomonas if they mention hot tub. Okay. The mucoid polysaccharide capsule may contribute to chronic pneumonia and cystic fibrosis. And also, we have to mention how Pseudomonas is very high yield for cystic fibrosis too. So that's another one. So the risk factors, I want you to write it down over here for your quick review. That is DM, diabetes. Then it's responsible for hot tub folliculitis. Write that down. Hot tub folliculitis is high yield. Cystic fibrosis is high yield. And it's also high yield for otitis externa maligna. Okay. These 4 things are the most high yields for over here. This produces PEEP. These are all the virulence factor. First of all, Pseudomonas. What is the mechanism of action of the toxin of Pseudomonas? Pseudomonas. Okay, which other toxin inhibits elongation factor 2? Which other toxin inhibits elongation factor 2? Diphtheria toxin. Okay. So Pseudomonas will produce phospholipid C. It will also produce endotoxin that can cause fever, shock, and exotoxin. So it can cause high possibility it can cause sepsis because it produces both exotoxin and an endotoxin. We also talked about the fact. How Pseudomonas is producing pigments, that is pyoverdin and pyocyanin, that is their blue-green pigments. So that's that. So they will appear in bluish greenish. They have a bluish greenish sort of a colony over here. So that's that. Over here, as you can see, that the colony is bluish greenish. So that's because of pyoverdin and pyocyanin. And they also generate reactive oxygen species. Okay, corneal ulcers and keratitis in contact lens wearers and minor eye trauma. They can also get these types of presentations from Pseudomonas, but it's not very high yield, so don't worry about this. Ecthyma gangrenosum is high yield, but to be honest, the presentation will not come with the help of with this sort of a picture, or even if it does, they will tell you that these patients they were in some sort of a hot tub or something, and then after that they had a history of folliculitis, carbuncle, and then they came up with an ulcer like this, and this is Pseudomonas infection. Okay, so that's that. So another one is they can tell you that when they made a culture from this, they found gram-negative Arabic rods, which were oxidase positive. Now, what is the diagnosis? The diagnosis is Pseudomonas. Okay, next one. Next one is the names of the treatments of the drugs. These are extremely high yield, not only for step one, but also for you becoming future physicians. That is, Pseudomonas is a very common infection, and you have to know exactly which drugs we prescribe. So we have Campfire for this. Campfire is carbapenem, aminoglycoside, monobactam, polymyxines, fluoroquinolones, third generation cephalosporin, that's IR for both, and E for extended spectrum penicillin. So carbapenems, aminoglycoside, monobactam, polymyxine, everything will be, these are tested by the fact that they will identify the organism in the question stem, and they will ask you which drug will you choose from A, B, C, D, E to treat this organism, and you have to choose any drug from over here, from all of these ones: carbapenem, aminoglycoside, monobactam, polymyxines, fluoroquinolones, third generation cephalosporin, and or extended spectrum penicillin. Okay. Okay. So have you guys underlined everything about Pseudomonas? Yes or no? Yes. Okay. Everyone else, have you guys underlined everything from Pseudomonas? Phospholipase C is tested? No. It's tested because it's tested by the virulence factor. They will tell you that there's a virulence factor, but just remember the word PEEP. PEEP. P for phospholipase C, endotoxin, exotoxin, and the pigments pyocyanin and pyoverdin. Okay. Okay. So are we ready to begin Salmonella and Shigella? Everyone, can you guys hear my voice? Are we ready to begin Salmonella and Shigella? Okay. Salmonella and Shigella. Okay. Both Salmonella and Shigella, these are gram-negative rods. Okay. So if it's gram-negative, let's come back to the classification once again. I would need your participation. Once again, it's gram-negative. If it's gram-negative, what is the shape of Salmonella and Shigella? Well, what is the shape of Salmonella and Shigella? Rod shaped. If it's rod shaped, what is the next test we do? Lactose test, lactose fermentation. Very good. If it's positive or negative. Okay, so is this positive or negative lactose? Negative. If it's lactose negative, what is the next test we do? Oxidase test. If it's oxidase negative, what is the next test we do? Hydrogen sulfide on TSI agar. Okay. If it produces hydrogen sulfide, what are the two organisms? If it does not produce hydrogen sulfide, well, what are the two organisms? Shigella and Yersinia. Very good. Okay. Shigella and Yersinia. Okay. So these are gram-negative, non-lactose fermenting, oxidase negative, and they can invade the GI tract via the M cells of the Pear's patches. Pear's patches, okay? So via the M cells of the Pear's patch, they can invade the GI tract system and enter the blood and disseminate. This is high yield, the Pear's patch. Okay. Okay, let's talk about Salmonella first. Salmonella, the reservoir is in the humans. They can disseminate hematogeneously, meaning that they can spread in the blood. Hydrogen sulfide production is there, we know that, okay? The virulence factor is basically for Salmonella is VI capsule. For Salmonella typhi, okay, it's VI capsule. Infectious dose is very high, meaning that you need a lot of this organism to cause the disease. If you ingest a small amount, there might not be any signs symptoms. Your immune system can fight it off. But if it's a high amount, there's a possibility you will get infected. And effect of antibiotics on fecal excretion, this is very high yield. This basically means that when the patient is treated with antibiotics, the patient will be asymptomatic, but the patient will shed the bacteria via their stools. So they have a higher possibility of infecting other people. So this will increase the duration of the antibiotics on fecal excretion. So the longer time they are on antibiotics, the longer time they will keep on shedding the organism. Immune response is monocytic for typhi, and for all the other salmonellas except Salmonella typhi, excuse me, it's polymorpho it's PMNs, polymorpho neutrophils, okay, in disseminated disease. GI manifestation is constipation followed by diarrhea. This is very, very high yield. This is how they will describe the disease. That they will tell you that you have a patient who has been suffering from constipation and diarrhea on and off, and that is very indicative of Salmonella infection. And over there, this is diarrhea as a whole. Next one is vaccines. Vaccines is oral vaccine, which is which contains live attenuated Salmonella typhi, and the intramuscular vaccine contains VI capsular polysaccharide. Okay, so there are two, oral and IM. The unique properties is that typhoid fever, okay, typhoid fever will come with fever, rash, and diarrhea. So the rash is basically rose spots on abdomen, okay, the rose spots on abdomen. So basically, they will have, so basically the rashes will start like this, and then it will spread, okay. There will be rose spots on the abdomen, followed by fever, GI ulceration, and it's treated with ceftriaxone and fluoroquinolones. Okay, so there's treatment with ceftriaxone and fluoroquinolones. This is not high yield, so I'm not gonna underline this. I'm not gonna underline the treatment, but the presentation is very high yield. That is rose spot, fever, rash, and diarrhea. The rashes are rose spots on the abdomen. Next one is the organism is carried in the gallbladder. Okay, there is gallbladder colonization. So your organism is carried in the gallbladder. It stays in the gallbladder for a longer period of time, and then it can get disseminated. Over here, the unique properties are not very high yield. So if you want, you can skip this out. Okay, that poultry's eggs, pets are common sources, not that high yield. Antibiotics is not indicated, not high yield. The highest yield one is that you do not have any vaccine. There's no vaccine for all the other species of Salmonella except Salmonella typhi VI. Okay, so that is all for Salmonella. Okay, so once again, Salmonella. I know that there's a lot of information, so just let me ask you first and foremost, Salmonella. Can anyone describe the organism to me? Can anyone describe the organism? I want you guys all to describe the organism. How does the organism look like? Gram negative, then rod shape, then non-lactose fermenting, oxidase negative. Okay, good, very good. Salmonella. First and foremost, do you need a lot of Salmonella or a small amount of Salmonella to cause a disease? Okay. Now, what is the common presentation of salmonella? Constipation followed by diarrhea. What are the other things that happens in salmonella? Okay, good. Fever, rash, and rose spot abdomen. Do we have any vaccines against salmonella? Okay. Okay, good. So that's that. Now, let's talk about Shigella. Shigella is also a gram-negative rod. Okay, it's gram-negative, non-lactose fermenting, oxidase negative, but it does not produce hydrogen sulfide or TSI agar, along with Yersinia. There's only humans. Humans are the only reservoirs, just like salmonella. And over here, the spread is hematogeneously, meaning it will spread in the blood. That is typhoid fever. So you can do a blood culture and see if you have typhoid infection or not. But over here for Shigella, there's no hematogenous spread, meaning that this organism will spread from one cell to another cell. Okay, this organism, if you have cells lined up like this, this organism will move from one cell to another cell, and so they will not get out. Okay, they will produce endotoxin, and we all know the mechanism of action of Shiga toxin. What is the mechanism of action of Shiga toxin? What is the mechanism of action of Shiga toxin? Yes, you will not have lifelong immunity. You will need booster vaccines. Inhibits 60 subunit. Okay. Does everyone remember the mechanism of action of Shiga toxin? Okay, good. So they will produce endotoxin, that is Shiga toxin. And the thing with Shigella is a very small amount is enough to cause the infection, meaning it's highly virulent. And if you treat them with antibiotic, they will not be discharged in the feces and cause infection. The ones like salmonella does. So there's nothing to be worried about. There is also a neutrophilic infiltration over here, and the presentation is crampy abdominal pain. So there will be crampy pain followed by bloody diarrhea. There will be bloody diarrhea. This is known as bacillary dysentery. So crampy pain followed by bloody diarrhea. This is Shigella. Okay. The sources are fingers, flies, foods, and feces. Basically, it's a fecal-oral route source. The source is a fecal-oral. And there are four types of Shigella, that is dysentery, flexneri, boydii, and Shigella soni. And over here, there's only one question which you might receive in UWorld, that is, which of this, dysentery, flexneri, boydii, or soni, is more severe? Okay, in more severe. So as you can see, in order of decreasing severity. Okay, so the dysentery is more severe, and soni is the less or the least severe. So that's that. Invasion of M cells is key to pathogenicity, and organisms that produce little toxin can cause the disease. Your organisms that produces very little toxin, they can cause the disease. Okay, that's that. Okay, next one. Next one that we're going to go to is Yersinia. First of all, Yersinia is a gram positive or gram negative. Gram positive or gram negative. Gram negative. Okay. What is the shape of Yersinia? What is the shape of a Yersinia? Rod shape. Is it lactose positive or not? Lactose fermenting positive or not positive? Lactose negative, non-lactose fermenting. Then what test do we do next? Okay. If it's oxidase negative, what test do we do next? Hydrogen sulfide on TSI agar. And if it does not produce hydrogen sulfide, then which two organisms are we talking about? Yersinia and Shigella. So Yersinia, this is a gram-negative pleomorphic. Either it's a rod or a coccobacilli. It's not very high yield, but in most cases, it's a rod. It's usually transmitted from pet feces, that is from puppies, contaminated milk or pork, and this can cause acute bloody diarrhea and pseudoappendicitis. So the presentation of this one, the presentation of Yersinia enterocoletica, okay, you will have right, you will have right lower abdominal pain, okay, lower abdominal, lower, right lower abdominal pain with diarrhea. First of all, you will have severe right lower abdominal pain, which will make you think that you have an you're having an episode of appendicitis. But then following that pain, you will have severe diarrhea. If you have this sort of a presentation, this is known as pseudo appendicitis. You most probably have Yersinia enterocolitis infection. So Yersinia is there. So it's a gram-negative pleomorphic rod. And the only question you will get is from the identification. So this is the most common presentation, right lower abdominal pain with diarrhea, and it's gram-negative rod. This can also cause reactive arthritis in adults, but it's not very high yield or highly tested. But the pseudoappendicitis and bloody diarrhea is more tested over here. Okay. Okay, good. Now, okay. So we have Shigella, Salmonella, and Yersinia. Out of all of this one, which one will produce infection with a small amount of inoculation? Fast answers. With a small amount of inoculation. Shigella. Very good. Okay. Fever followed by crampy abdominal pain and tenesmus. Which organism is this? Shigella. Okay. Okay, good. Okay. Fever followed by raw spot on the abdomen and diarrhea. Which organism is this? Okay. Okay. Uh, Doctor, can we ask? Okay. Is anyone confident to describe the organism Shigella, how it looks, everything, the properties? Only one person who can describe? Okay, me. Okay. Let's ask Dr. Hossam first, as he said yes first. Okay, so please describe the organism that is Shigella. Gram negative, rod, then lactose negative, lactose fermenting negative, oxidase negative, and TSI and hydrogen sulfide producing. It's non-hydrogen sulfide producing. So that okay, good. Next one is, let's move on to lactose fermenting enteric bacteria. So you have fermentation of lactose, that is, you will have pink colonies on McConkey agar. McConkey agar. The examples are E. coli, Klebsiella, Enterobacter. Okay, these are they will all produce beta galactosidase A, which will break down lactose into glucose and galactose. So that's that. Beta galactosidase A. The lactose is the key, and you can culture E. coli on EMB agar, that is leucine methylene blue agar. The lactose fermenter will grow as purple black colonies. Okay, then they will, and the E. coli will have a green shin to it. They will have a green shin. Okay, so E. coli for leucine methylene blue. That's all you need to know. And over there, in using methylene blue, the E. coli will look green. Okay, so green colonies. So for green colonies, we have two ones, that is Pseudomonas and E. coli. So don't forget that. For Pseudomonas, it's due to the pigment, and for E. coli, it's on using methylene blue. Okay. Okay, good. So let's move on to Escherichia coli as a whole. First and foremost, once again, E. coli gram positive or gram negative. I will keep on doing this because this will help you. Gram negative. Then, what is the shape of E. coli? What is the shape of E. coli? Okay, curved rod. Are you sure it's a curved rod? It's not a curved rod. It's just a rod. Yeah, okay, it's just a rod. Okay, E. coli is a rod. If it's a rod, then is it lactose fermenting or non-lactose fermenting? Lactose fermenting. Is it a fast lactose fermenter or a slow lactose fermenter? It's a fast lactose fermenter. Okay. Now, E. coli. E. coli, we talked about the toxins of E. coli. Do you guys remember enterotoxigenic E. coli? We talked about the toxin, and we also talked about enteroinvasive E. coli. Yes. What is the mechanism of action of the Shiga-like toxin that is produced by E. coli? Shiga-like toxin, enteroinvasive E. coli. What is the mechanism of action? 60S subunit. Very good. Okay. What is the mechanism of action of enterotoxigenic E. coli, the one which produces normal diarrhea, non-bloody diarrhea? Increased CEMP. Which one had heat labile and heat stable toxin? Heat labile and heat stable toxin. Okay. Which one, heat label or heat labile, which one will increase CMP, which one will increase GMP? Heat labile is CMP, heat stable is GMP. So stable on the ground and labile in the air. Okay. Uh, Believe me or not, but this is the only information that is important for E. coli. Okay, that this is the only information. All the informations you just said, the properties, the growth medium, the color of the organism in the growth medium, the toxins, what it causes. That is all you need to know. In all honesty, that's all you need to know. So that's that. I'm glad you guys remember this from your basic knowledge of bacteriology, which we studied from first aid. So that's that. The first 4 or 5 pages of microbiology is very high yield for each and every organism. So having said that, let's learn about the strains. Okay. First and foremost, E. coli is a gram negative, and it's also indole positive. Okay, that's another test we do. It's indole positive, not very high yield, but that's it. E. coli virulence factors. These are another thing that is high yield. That is, every virulence factor is responsible for causing a different type of a presentation. Out of all the things which you have just said, this is also another high yield thing that is usually tested. That is the virulence factor of E. coli. That is, if the E. coli is responsible for causing cystitis and pyelonephritis, then it's the fimbriae of the E. coli that is causing this disease. Okay, there's number one. Number two is if you have pneumonia, okay, if you have pneumonia, then it's the capsule which is causing the pneumonia. That is E. coli causing pneumonia. Which part of the E. coli or which virulence factors is responsible for causing E. coli pneumonia? And it's the capsule. So pneumonia and pneumococcal meningitis, that's the K capsule. Next one is lipopolysaccharide is responsible for causing septic shock. That is also another one. We know that is high yield, but we know this. And don't forget that the fimbriae is responsible for causing cystitis and pyelonephritis. And for pyelonephritis, you also have the P. pili. That can also cause pyelonephritis. So underline this, put your star marks because you will be tested on this. Okay, next one. Enteroinvasive E. coli, the microbes will invade the intestinal mucosa and cause necrosis and inflammation by inhibiting protein synthesis. Okay, because they act like Shigella, that is, they inhibit the 60S ribosomal subunit. So that's one way. Enterotoxigenic E. coli, we talked about this, heat labile and stable. That is, one will increase CMP, that is, the labile will increase CMP, and stable will increase GMP, and this will cause diarrhea. This is easy to understand. Enteropathogenic E. coli is no toxin producing. Okay, it adheres to the apical surface and it flattens the villi as a whole. So it works almost more or less, if not very close to, the rotavirus. So that's how it works. That is, it does not produce anything, but it just prevents absorption. As a result, it produces pediatric diarrhea. This is more common in young patients. Okay, enteropathogenic, P for pathogenic, P for pediatrics. So that's that. Not really highly tested. These two are more tested than that. So, enterohemorrhagic is 015787 is the most common serotype in US. underline this, often transmitted via undercooked meat, raw, and leafy vegetables. The Shiga toxin causes hemolytic uremic syndrome. This is high yield because patients will have, okay, if I tell you you have a patient who has enterohemorrhagic E. coli, which sort of RBCs are you supposed to find in the peripheral blood film? Fast answers, please. What sort of RBCs are you supposed to find in the peripheral blood film? Hemolytic uremic syndrome. Which sort of RBCs are we supposed to find? Schistocytes, very good. Okay, so the RBCs, there will be hemolytic uremic syndrome is characterized by anemia, thrombocytopenia, and acute kidney injury with microthrombi production. So if this is a blood vessel, there are microthrombus like this, right? So when an RBC, when they pass through this, they have mechanical wear and tear, and they come out looking like this. Okay, they come out looking like this. This is a schistocyte. So hemolytic uremic syndrome is characterized by anemia, thrombocytopenia, and acute kidney injury with microthrombus production, and with mechanical wear and tear, you have schistocytes on the peripheral blood smear. This is high yield. This is very commonly asked on NBME. Okay. With platelet, there's also platelet consumption and decreased renal blood flow. As that, okay. It does not ferment sorbitol. It's hemorrhagic hamburgers and hemolytic uremic syndrome. Okay, this is not something which you need to use, so don't worry about this. And it also causes dysentery. Enterohemorrhagic E. coli will cause dysentery. The toxin alone will cause necrosis and inflammation. But they don't really test you on the hemorrhagic E. coli toxin, so you don't have to worry about that either. Only thing you have to remember is they can cause hemolytic uremic syndrome, and this can cause schistocytes because this is more commonly tested. Okay. There's also another question in your NBME. I'm not sure if you will get it on. You have a pregnant mother who has hemolysis, elevated platelet count, and increased liver enzymes. What sort of RBC presentations are you supposed to see on the peripheral blood film of the mother? Fast answers. Hemolysis, elevated liver enzyme, and low platelets. What is the name of this syndrome? HELP syndrome. Okay. What sort of RBC presentations are we supposed to see in HELP syndrome? Schistocyte. Okay. So that's that. Do we also see schistocytes in DIC? Okay. Next one is Klebsiella. Okay. Once again, gram positive or gram negative? Klebsiella, gram positive or gram negative? It's gram negative. Okay. If it's gram negative, what is the shape of Klebsiella? Gram negative, it's a rod. If it's a rod or a bacilli, what is the next test that we would do? Lactose. If it's lactose, is it lactose positive or lactose negative? It's positive. Is it a fast fermenter or a slow fermenter? Fast fermenter. What is the other organism that is a fast lactose fermenter? E. coli. Okay. So Klebsiella, very high yield. Which organism will cause pneumonia and diarrhea together? Legionella. Okay. Klebsiella is a gram-negative rod intestinal flora that causes lobar pneumonia in alcoholics and diabetic patients when aspirated. Okay, this presentation is very high yield. So this is present more or less in the intestinal flora, right? And when alcoholic or diabetic patients, when they sleep, for some reason, if they have aspiration of their intestinal content, especially the saliva, If it aspirates, that is the intestinal mucus mixed with the saliva. If it aspirates into the lungs, there's a high possibility that these patients will get Klebsiella. This is very common in this is very common for causing aspiration pneumonia. Aspiration pneumonia. Okay. Easiest way to find out is that the patients will have currant jelly sputum. Red currant jelly sputum. Okay. They will have red currant jelly sputum. Okay. Have you guys ever had um, like a strawberry jelly or red currant jelly for that reason? I'm sure you guys have had jellies, right? Okay. Imagine how a patient would look like if they cough and that jelly comes out of their mouth. Okay, that's exactly what Klebsiella would look like. As exactly what. So it looks like currant jelly sputum. Okay, I apologize for painting that disgusting picture, but that like it is what it is. So that's how it looks like. It also it's an important cause of nosocomial UTIs. Okay, so patients who are in the hospitals, if they get UTIs, then Klebsiella is a very high yield organism for that. If I tell you that there's a young female who recently got sexually active, if she has UTI, which organism am I talking about? Young females, saprophyticus. Very good. Okay, saprophyticus. This is for nosocomial UTIs. Nosocomial UTIs is Klebsiella. It is associated with evolution of multi-drug resistance, so MDR. MDR. So excessive use of antibiotics can also give rise to Klebsiella. Okay. So abscess in lungs and liver, red currant jelly sputum, and diabetic patients can also get Klebsiella. But which organism did we talk about in the past that is very high yield for diabetics? Pseudomonas. Very good. Okay, Pseudomonas. Okay, so now we are at the next part of gram-negative bacteria, that is gram-negative bacteria. If it's not coccobacilli, diplococci, or bacilli, what is the another shape of gram-negative bacilli? Gram-negative bacilli, curved. If it's curved, what do we see? Which test do we do to see if it's really curved or not? Oxidase test. Are they all oxidase positive? Okay, so we can confirm that they're curved rods because they're all oxidase positive. Okay, now if you have an organism that is, if you have an organism, okay, that is Campylobacter jejuni, Campylobacter, is it gram positive or gram negative? Fast answers, please. Shape. What is the shape? It's not coma shape, it's curved rod. Okay, it's a curved rod shape. Is it oxidase positive or not positive? Okay. Now, then the next one is, how will you identify that it's a Campylobacter? Is there a certain temperature at which you can camp outside? It's 42 degrees Celsius. So they will grow at 42 degrees Celsius. If I tell you that you have another curved rod which grows in an alkaline media, which organism am I talking about? Vibrio cholerae. If you have another organism which is a curved rod, oxidase positive, and urease producing, which organism am I talking about? H. pylori. Very good. Okay. Campylobacter jejuni. Okay. This is a gram negative curved rod, coma shape. I personally do not like using the word coma shape because whenever you hear coma shape, the first bacteria you should think about is Vibrio cholerae. So we will say it's gram negative curved with S shaped, oxidase positive. It grows at 42 degrees Celsius. That's a major cause of bloody diarrhea. So these patients, they will have bloody diarrhea along with the fact that they can also get paralysis. They can also get ascending paralysis. What is the name of this syndrome? Ascending paralysis after bloody diarrhea? GBS, Guillain-Barré syndrome. Guillain-Barré syndrome. So this is a major cause of bloody diarrhea, and this is a common antecedent to Guillain-Barré syndrome and reactive arthritis. but Guillain-Barré syndrome is more high yield. Okay, especially in children, there's a fecal-oral transmission through person-to-person contact or by ingestion of undercooked, contaminated poultry or meat, unpasteurized milk. Contact with infected animals is also a risk factor, and this will cause Guillain-Barré syndrome. The Guillain-Barré syndrome is basically it's more or less like an autoimmune disease, right? I mean, what happens is when a patient gets affected with Campylobacter jejuni, there's a sort of molecular mimicry that happens that your immune system they start attacking the myelin sheets of the nerve fibers, and patients get um, paralysis, weakness and paralysis, and it's an ascending paralysis it will start from the legs down below, and it will keep on ascending upwards if it's not treated. The treatment for Guillain-Barré syndrome is IVIG. Always remember this. We give IVIG, intravenous immunoglobulin. Okay. Next one. Next one is Campylobacter jejuni. Vibrio cholerae. Okay, my apologies. Vibrio cholerae. Vibrio cholerae is a gram-negative curved rod, flagellated, meaning that they have a flagella, which will help them move very fast. It's oxidase positive and it grows in the alkaline media. We talked about this. This is very high. This is very easy to understand that Vibrio cholerae is a very common organism for causing diarrhea. This is known as cholera. I'm sure you guys have heard of cholera a lot. Okay, so this is endemic to developing countries. This produces rice water diarrhea and via enterotoxin that permanently activates GS. Do you guys remember we talked about the enterotoxin of the cholera? Yes or no? An increased fluid secretion. Yes. Okay. So it will increase CMP. If it increases CMP, which ion will increase in the gut? Sodium chloride or chloride only? Which ion secretion will be more? Chloride. Okay. So there will be chloride efflux. Very good. So there will be increased GS and increased CMP. Sensitive to stomach acid, meaning in its acid level, it requires a large inoculum. So high amount is needed to cause the disease. And over here, if there is a patient with decreased gastric acidity, okay, this can cause the disease. Yeah, so can we assume that patients who are on PPI, they have a higher possibility of having Vibrio cholerae infections? So that's that. Transmitted by ingestion of contaminated water or uncooked raw shellfish. For USA, this is high yield. Raw shellfish. Okay, this is high yield for Vibrio cholerae. They will use this association to make the questions. Okay, and this is usually self-limiting. They will usually be okay. We do not necessarily provide any antibiotic, just severe oral hydration or IV fluid hydration, and it usually subsides in 1 week. So that's that. That's Vibrio cholerae. The presentation is very important. How does it look like? Okay, next one. Next one is Helicobacter. It's once again, it's gram-negative, curved, oxidase positive, and it will grow in an alkaline media. So it's a gram-negative, curved, flagellated, and it is oxidase positive. It's also urease positive, and it's catalase positive. Okay, this can cause urea breath test. Okay, so what happens is since this produces urease, Helicobacter pylori, this loves to stay inside in alkaline conditions. So what happens is you have this stomach, right? For example, this is the stomach of the patient. If this is the stomach with the stomach acid, okay, this is the stomach with the stomach acid over here. The Helicobacter pylori organism, they would love to move this way, that is, away from the acid. They would love to move away from the acid towards alkaline or more neutral conditions so that they can survive for a longer period of time. So what happens is the more acid you have, the higher chance it is for the H. pylori to move away, and this will keep on eating away your stomach mucosal lining. Okay, and this can cause severe ulcers, and H. pylori is, as we know, is one of the most common cause of peptic ulcer. It's also urease producing. So basically, meaning that if you do a urea breath test over there, this will break down the urease to produce ammonia and carbon dioxide, which we can test. And this is a pretty non-invasive test that we can do to detect H. pylori. We can also test for H. pylori antigen, that's also there. And if this urease, this produces the ammonia, which creates an alkaline environment, helping the H. pylori to survive in the acidic mucosa. And then you also have them moving from one cell to another and causing the ulcer. So that's that. They colonize mainly in the antrum of the stomach. So that is also high yield. Which part of the stomach will they colonize more? That is the antrum. Okay, the antrum of the stomach colonization is more. It will cause gastritis and peptic ulcer. The risk factors for peptic ulcer disease and gastric adenocarcinoma and mucosal associated LT lymphoma. So mouth lymphoma. Okay, so that's that. I'm not gonna do this one. I'm just gonna do peptic ulcer and gastric adenocarcinoma. For Helicobacter pylori, we have triple therapy. Okay, have you guys heard of triple therapy before? Yes or no? Okay, I'm pretty sure you guys have all heard of triple therapy, right? Triple therapy is basically what we use to treat Helicobacter pylori. It's a combination of amoxicillin with either clarithromycin or PPI. Okay, amoxicillin, clarithromycin, or PPI. And this can also become a quadruple therapy if you use bismuth. Okay, this is high yield. There's a question in step one, UWorld step one, that is which other uh, pharmacological agent can you add to triple therapy to make it a quadruple therapy? And over there you have antiemetics and this and that, but bismuth is the one. So bismuth. Okay, bismuth is the one. Okay. Now, the next one that we want to go to is spirochetes. Spirochetes. Okay, is everyone ready for spirochetes? Spirochetes. Okay. Spirochetes. Spirochetes are basically spiral-shaped bacteria. Spiral-shaped bacteria. You have three bacteria, and out of them you have Borrelia, Leptospira, and Treponema. Every one of these organisms are high yield. Every one of these organisms are high yield for step one, because you will receive a lot of questions from Lyme disease, leptospirosis, and syphilis, and the amount of questions that you will receive from over here is endless. So you have to put a very special attention to these diseases. Okay. Borrelia, Leptospira, and Treponema. Only Borrelia can be visualized using aniline dyes, that is a right or Giemsa stain in light microscopy due to the size. Treponema is visualized by dark field microscopy or direct fluorescent antibody microscopy. So that's what we would do, but you do not have to learn anything from over here. You will learn it as you learn the disease. So let's move on to the first disease. And for this disease, I want to use the physio video because I want to make sure that you guys remember everything. Okay. Physio for Lyme disease. Okay, this is very high yield. You will get a lot of question from Borrelia burgdorferi. Okay, is anyone would anyone be kind enough to take a picture of Borrelia from physio? Yes or no? Would anyone be kind enough to take a picture? Help me out because I cannot take a picture over here, because if I do, this account will get deactivated. Anyone? Can anyone help me take a picture, please? Okay, Dr. MS. Dr. Hossam, did you upload the pictures from yesterday? Dr. Hossam, did you upload the pictures from yesterday? Okay, please upload those pictures because we received a lot of emails about those pictures. Okay. Okay, thank you. And Dr. MS, can you also upload the pictures when you take it today? Okay. Okay, 1 second. Okay, let's find Borrelia. Borrelia, Borrelia. There you go.
Welcome to section 44 of bacteria. This is our bacteria overview figure. In this video, we'll be discussing Borrelia burgdorferi, which causes Lyme disease. You can see Borrelia right here. This scene takes place at a fancy car dealer business with this burglar guy attempting to break in. As you can see, he has a mask on and is getting ready to break into the back door. So burglar for Borrelia burgdorferi. Next, notice that we've shown a spiral staircase that goes from the first floor of the business to the second floor. This is to help you remember that Borrelia burgdorferi is spiral shaped, so it's a spirochete. This is an image of Borrelia burgdorferi using a dark field microscopy technique. As you can see, the organism is spiral shaped. All right, now notice that we've added a sign in the northeast corner of the image that says northeast corner. This is here to help you remember that the organism is common in the northeastern part of the United States. Now notice that we've shown the burglar guy eating some Tic Tacs. I guess he wants his breath to be fresh during this robbery. Also, the fact that he's eating this below an exit sign should help you remember ixodes. So putting these two ideas together should help you remember that Borrelia burgdorferi is transmitted through the ixodes tick. This is an image of the ixodes deer tick, and as you can see, they're pretty small and can be difficult to spot, so tick bites often go unnoticed. Now notice that we've shown a girl with very long red hair who appears to be changing a baby's diaper. Let's zoom up so you can see this better. If you've ever seen the show Anne of Green Gables, then you can probably appreciate that this girl with long red hair resembles Anne, and Anne sounds like anaplasma, so she'll be our symbol for this bug. Also, baby sounds like babesia, so Anne is here changing the baby to help you remember that the ixodes deer tick is also a vector for anaplasma and babesia. Notice that we've also shown Anne trying to entertain the baby with some games. Games sounds like Giemsa, so we've included this here to help you remember that Borrelia can be visualized using the Giemsa stain. This is a stain that uses aniline dyes and is very similar to another stain called the Wright stain. This is an image of a Giemsa stain of Borrelia, and as you can see, the organism is shown right here. All right, if we zoom back out, now you can see that we've added a deer chasing a mouse in the parking lot. These two friendly animals are here to help you remember that deer and mice are reservoirs for Borrelia and are important to the tick life cycle. Now let's turn our attention back to the burglar. As you can see, his shirt has a target on it because he just bought this shirt from Target. I guess he wanted a new clean shirt with very little of his DNA on it for this attempted robbery. Anyway, the target has a bullseye. And this is here to help you remember that stage 1 of Lyme disease is associated with a bull's eye rash, which is also known as erythema migrans. Okay, before we go any further, you should know that Lyme disease has 3 stages. So we've organized the image in a way to help you easily compartmentalize this information. Everything right next to the exit sign right here will represent stage 1 of Lyme disease. Everything inside of the building on the first floor right here will represent stage 2 of the disease. And finally, everything inside of the building on the third floor, right here, will represent stage 3 of the disease. Okay, with this in mind, let's move on. This is an image of erythema migrans. As you can see, there is a central region of erythema, right here, which is surrounded by a ring, and this resembles a bullseye. Next, notice that we've shown the burglar guy sweating profusely. This is understandable, right? He's about to break into a car shop, so he's a bit nervous. Anyway, the sweat is here to help you remember that stage 1 of the infection is associated with flu-like symptoms. All right, now let's move on to discuss stage 2. As you can see, we've added a bell right next to the entrance. Every time a customer walks in, the bell rings and alerts the staff that someone has just entered the building. Bell sounds like Bell's palsy, which is here to help you remember that stage 2 is associated with Bell's palsy. This is an image of Bell's palsy, and as you can see, this is characterized by paralysis of half of the face. So notice that as this patient attempts to smile, we only see half of a smile. Also notice how the eyebrows and forehead appear different. So this side of the face is normal, and the opposite side is paralyzed. This is an image from neurology, which we discussed in the sections on the cranial nerves. I'm not going to walk through the pathophysiology again, but it is important that you understand how Bell's palsy develops, so I would highly recommend that you go review this information if you haven't covered it yet or if you've forgotten it. Okay, now notice that we've shown one of the cars on fire, and this employee is attempting to put it out. We've been using cars in our other images to represent cardiac problems. So the fact that this car is on fire should help you remember carditis, or inflammation of the heart. So stage 2 of Lyme disease is associated with carditis. Now you can see that we've added a pregnant lady trying to come into the store, but she's being turned away by the manager with a sign that says closed. I guess the car incident has made it unsafe for customers, so they're closing early today. Anyway, this manager guy is essentially blocking the customers from entering the car store, which should make you think of atrioventricular block. The fact that he's in a car store should make you think of cardiac block. So putting these two ideas together should help you remember that stage 2 is associated with AV block. Now let's move on to discuss stage 3. Notice that we've added 2 employees on the second floor of the building. One of the employees is working hard on his knees and scrubbing the ground. As you can see, his knees and elbows have become quite red from all of this work, which looks pretty painful. The fact that the knees are red, and now that this pain has migrated to the elbows, is here to help you remember that stage 3 of the infection is associated with migratory arthritis. This is a condition characterized by joint pain that spreads from one joint to another joint. So just think of pain in the knees that has migrated to the elbow joints for migratory arthritis. While one employee is hard at work, the other is goofing off. Notice that he seems to think it's pretty hilarious to dump the bucket of water on this poor guy's head, who is so diligently scrubbing the floors. The fact that the water is on his head helps point toward a brain infection. The fact that it's being poured all over refers to an infection of the entire brain, so encephalitis. So stage 3 of the infection is associated with encephalitis. All right, now that we've talked about the 3 stages, let's finish by discussing treatment. Remember the burglar guy? Well, he drove here on his dirt bike, but intends to leave in an expensive sports car. Just like in our other images, the dirt bike is here to help you remember doxycycline. So first-line treatment for Lyme disease is doxycycline. Now you can see that we've added a guard to the image. This is an expensive building with a lot of valuable stuff inside, so the business has hired the security guard to patrol the perimeter. If we zoom up a bit, you can clearly see that he's wearing an ammo belt, which is our symbol for amoxicillin. Also, the fact that he's right next to the pregnant woman and the child should help you remember that amoxicillin should be used in pregnant women and children. Finally, notice that the little girl is holding a toy squid, or a cephalopod toy. This is to help you remember that cephalosporins, such as cefuroxime, can be used in pregnant women and children.
Okay. Dr. MS, were you able to take a picture? Dr. MS, were you able to take a picture? Okay, good. Okay, so Borrelia burgdorferi. Okay, now, which organism is responsible for transporting Borrelia burgdorferi? Fast answers, please. Which organism is responsible for transporting Borrelia burgdorferi? Okay, Exodus deer tick. Exodus deer tick. Okay, now Borrelia burgdorferi. Which other organism is also spread or transmitted by Exodus tick? 2 other organisms, Anaplasma and Babiosis. Okay, Babesia. Very good. Okay, so that's that. So it's caused by Borrelia burgdorferi, which is transmitted by the Exodus deer tick. Okay, Exodus deer tick, and for USA, this is very common, especially in eastern USA. That is in New York, New Jersey, over here. This is extremely common. New York, New Jersey, and all the eastern states. The natural reservoir is the mouse. Deers are an essential to tick life cycle, but they do not have Borrelia. So if you have deers will not necessarily cause the tick, but they can harbor Exodus tick. That is, the tick is there in the deers, but if the ticks bite you, then you have a higher possibility of having Lyme disease. There are 3 stages in which Lyme disease happens. First of all is an erythema migrans, that is a bullseye lesion, extremely high yield. You will receive multiple questions from this one, that is this bullseye lesion. But along with this lesion, you can also get fever. Stage 2 is early disseminated. Over here, you have AV block. Okay, then you have CNS. Then you have CNS sign symptoms, right? You have CNS sign symptoms. That is, what do you have with CNS sign symptoms? CNS symptoms that you have Bell's palsy. right? So you have the heart, which is affected, the brain, which is affected, and then what you can also get is arthritis. Okay, so arthritis also happens over here. So you have carditis, CNS symptoms, and arthritis. Basically, you have AV block, not carditis. So AV block, CNS symptoms, and arthritis. That is what happens in stage 2. Stage 3 is encephalopathy that will happen in chronic arthritis, but stage 2 is more common. Stage 2 and stage 1, they are more common. It usually do not go. It usually does not go to stage 3 because it's treated before it does so. That's that. Okay. The treatment is doxycycline, which is first line, and amoxicillin is also there. And basically, amoxicillin is used for CNS sign symptoms, and we can also give ceftriaxone, but doxycycline is number one. Okay. Okay. So once again, AV block, Bell's palsy, arthritis. Okay. Next one. Next one is leptospira interrogans. Leptospira interrogans. This causes leptospirosis. Before we, I also want to watch I also want to watch a physio video for leptospirosis so that you guys easily remember all the sign symptoms. But one of the most common symptoms over here, the word that I want you to focus on, the word I want you to focus on is conjunctival sufficient. This, they will use this word. They will use conjunctival sufficient. They will use this exact word in the question stems of leptospirosis. They will tell you that you have a farmer, okay, you have a farmer who, after working in the fields on bare feet, in the fields on bare feet, now comes to you with sign symptoms of liver damage, along with jaundice and photophobia, and there's also arthritis. So basically, leptospirosis is more common in farmers because this is found in this is a hook-shaped organism, which is a spiral hook-shaped organism that is found in water contaminated with animal urine. So if you have your patients who are basically farmers or anyone who is in close contact with animals and they're roaming around in the environment of the animals without wearing anything on their feet, then this leptospira can enter the bloodstream via penetrations of the skins. So that's what happens. And then once it does, you have your fever. You have the signs symptoms of the infection, that is fever, joint pain. Along with this, what it causes is it causes conjunctival sufficient. That is, they cause something which looks a bit like conjunctivitis. So the conjunctivitis, meaning that you have a red eye, okay, but there is no exudations or pain. It just has a red, the eyes just look red. This is called conjunctival sufficient, and this is very indicative of leptospirosis, especially in the step 1 question stem. This word sufficient is very indicative, so don't forget this. It is very common amongst surfers also and farmers. Will's disease is an icterohemorrhagic leptospirosis with a severe form with jaundice and azotemia, meaning that if it's not treated, if leptospirosis is not treated, then it can transform to Will's disease. This is basically a more severe form with fever, jaundice, and end organ failure. That is liver failure. Then you can also get a kidney failure, right? And along with this, you will get fever and anemia. So that is Will's disease. Let's watch the video for leptospirosis. We will not watch any more videos, at least from spirochetes, although I did plan on watching a video on anaplasma and babesia because they are very different. Okay, this video over here, I mean, Ehrlichia and anaplasma along with babesia. So that's another video that we will watch for today and no other videos. We will obviously not watch Treponema pallidum because there's a lot of information over here. You cannot remember this, but we will watch the small one, okay? So Dr. MS, are you going to take the responsibility again to take a picture of leptospirosis? Yes? Okay. Okay, so it's a 3-minute video. It's not that long. It will help you remember.
Welcome. Welcome to section 45 of bacteria. This is our bacteria overview figure, and in this video, we'll be discussing Leptospira interrogans, which you can see right here. This scene will take place in the tropics near the beach with this guy surfing. Notice that he's holding a spear in one hand as if he's hunting something. Spear sounds like Leptospira, so we've shown this guy holding a spear to help you remember that this image is all about Leptospira interrogans. If you look closely at the waves, you can see that they resemble a spiral. And this is here to help you remember that this organism is a spirochete. This is a scanning electron microscope image of Leptospira interrogans. As you can see, the organism has the characteristic spiral shape. Now you can see that we've added another guy to the scene who appears to be fishing. Look at that hook on the end of his fishing pole. He's definitely fishing for something. At the same time, he doesn't seem to be very environmentally friendly based on all of the oil spilling out of the back of his boat. In any case, the hook on his fishing pole and the yellow oil spill that resembles urine are here to help you remember that Leptospira is a spirochete with hook-shaped ends, and that it's commonly found in water contaminated with animal urine. Okay, now let's move on to discuss leptospirosis and whale disease. Leptospirosis is simply the clinical manifestations caused by Leptospira interrogans, and whale disease is a more severe form of leptospirosis. Okay, with this in mind, notice the tropical trees in the background. This is to help you remember that leptospirosis is prevalent in the tropics. We've specifically made our main character surfing to help you remember that leptospirosis is prevalent among surfers. We've also made his board yellow like the color of jaundiced skin to help you remember that leptospirosis can cause jaundice. Next, notice that the surfer guy has sunglasses on and is looking away from the sun. This is to help you remember that leptospirosis can cause photophobia. Alright, now notice that we've added a whale to the image. Looks like the surfer guy and the fisherman have been hunting this poor whale and managed to land a spear in its side. Look at all that blood flying into the air. If you look closely, you can see that some of it has flown all the way over to the surfer guy and has landed on his glasses, making them red. The red spot on his glasses should help you remember that leptospirosis can cause conjunctival erythema. Also notice that the surfer guy is sweating. After all, surfing is pretty exhausting, right? So the sweat is here to help you remember that leptospirosis causes flu-like symptoms, including myalgias. Okay, now that we've covered leptospirosis, let's move on to discuss whale disease. Whale disease is simply a severe form of leptospirosis. So to help you remember this, we've shown a poor whale getting attacked by these two ruthless hunters. Now you can see that we've added an innocent Dalmatian dog on the fisherman's boat. As usual, the dog has a liver spot on its trunk, which is here to help you remember that whale disease can cause liver dysfunction. Remember the yellow board? This should help you remember that leptospirosis, including the more severe form, which is whale disease, can cause jaundice. Now notice that we've shown the dog holding up a lamp. The fishermen brought this along just in case they needed it for the evening. You never know how long it's going to take to catch a whale, I guess. Anyway, just like in our other videos, the lamp is here to help you remember that whale disease can cause a fever. Remember how the blood was splattering all over the surfer's glasses? Well, the blood that's shown closer to the whale appears to be quite a bit. With that kind of uncontrolled bleeding, the whale will most likely develop anemia. So this part of the image should help you remember that whale disease can cause hemorrhage and anemia. Finally, notice that we've added several shrimp underneath the fisherman's boat. These resemble the shape of kidneys, so they're here to help you remember that whale disease can cause renal failure.
Okay. So, Dr. MS, were you able to take a picture? Okay. Good. So that was leptospirosis for you. Okay. Can we move on to syphilis? Syphilis. Okay. Let's begin with syphilis. Syphilis is caused by a spirochete known as Treponema pallidum. So you have three spirochetes that are high yield: Borrelia, Leptospira, and Treponema. We are done with the first two. Syphilis is a very high yield sexually transmitted disease. It's caused by Treponema pallidum, which is a spirochete. The treatment is penicillin G. First and foremost, the first type of syphilis that happens is when there is first encounter. There is a painless chancre, as you can see over here, that on the penile shaft, you have this sort of a painless chancre. This is painless. And this, and over here, if you take a small amount of the specimen and you do a dark field microscopy, you will see that there is spiral shaped organism that is present in the dark field microscopy that's there. So the first one is primary syphilis over here. As you can see, the first lesion is the painless chancre. If you do a VDRL, that is venereal disease research laboratory test, it's positive in 80% of the cases. Next one is the secondary syphilis, disseminated disease with constitutional symptoms. This over here you can get a maculopapular rash like this, including in the palms and soles. Okay. Then you can get condyloma lata. which is smooth, painless, wart-like lesions on the genitalia, as you can see on the female genital tract. For example, you have condyloma lata-like infection. These are painless, and they are they are wart-like lesions. So they look a bit like papillomas. But when you do a culture over there, you can see in dark field microscopy, there is this spiral-shaped organism that's there. If you do a serology test, you can do VDRL or RPR. RPR stands for um, rapid reagent testing, RPR, and VDRL, which can confirm, and which is used as a screening purpose. But if you want to confirm, then you can do fluorescent treponemal antibody absorption test, FTAABS, fluorescent treponemal antibody absorption test over here. This is for confirmation. And VDRL and RPR, rapid reagent testing, and venereal disease research laboratory. These two are done for screening. Secondary syphilis is more systemic, and latent syphilis is positive serology without any symptoms. That can also happen. For example, you do not have any sign symptoms, but you can get you can get syphilis. So for primary one, always remember there's a chancre. That's it. For secondary, you have rash, especially on the abdomen and on the hands, and you can also get condyloma lata. That's for secondary. So that's one. This is for secondary. Okay, and the rest are for tertiary syphilis. Tertiary syphilis is known as gammatous syphilis. Gammatous syphilis, gammas are basically granulomas. As you can see that there's a big gamma over here. This is the face, unfortunately, where the gammatous syphilitic lesion is present. Or this can also happen in the faces. And then another thing is syphilis can cause aortic regurgitation because this causes end arteritis. So you have aortitis followed by end arteritis. Patients can have aortic regurgitation, aortic valve regurgitation. Neurosyphilis can also happen, that is tabes dorsalis. Tabes dorsalis, which column is more affected for in tabes dorsalis? Fast answers, please, in the spinal cord columns. Which column is more affected for tabes dorsalis? Dorsal column, very good. So tabes dorsalis is there, okay? You can see Argyll-Robertson pupil. Argyll-Robertson pupil is that the pupil will accommodate but will not react, okay? This is also known as prostitute's pupil because it will accommodate but it will not react, okay? Apparently, I'm not really sure how this helps. I always found it a bit absurd that that's what they would call it. I've never heard anyone call Argyll-Robertson pupil prostitute's pupil, okay? But if you want to use this mnemonic, you're more than welcome to do so. Basically, this is a pupil which will accommodate in distal and near vision, but it will not be reactive to light. So that's an Argyll-Robertson pupil. For neurosyphilis, we can also test the spinal fluid with VDRL. And if it's VDRL positive, we can confirm it with fluorescent treponemal antibody absorption test or polymerase chain reaction, that is PCR. Okay, so first one, what is the name of the first lesion of, what is the name of the lesion in primary syphilis? Fast answers, please. What is the name of the lesion in primary syphilis? Painless chancre. What is the name of the lesion in secondary syphilis? Secondary syphilis. Name of the lesion? Condyloma lata. What is the name of the lesion in tertiary syphilis? Gammas. Okay. Now, let's talk about congenital syphilis. Let's talk about congenital syphilis. Congenital syphilis, it presents with facial abnormalities such as raggeds. Raggeds are linear scars at the angles of the mouth, as you can see. These are raggeds. Okay, at the angle of the mouth, and they can also call nose snuffles. That, as you can see, this young baby over here has a lot of discharge from the nose. This is what can happen. So you can have raggeds and snuffles. Okay, nose discharge. You can also get a saddle nose. Okay, nose is saddle, or you can get Hutchinson's teeth. Hutchinson's teeth, as you can see over here, it's this one with the indentation over here, right? With indentations on the incisors. So this indentations on the incisors, these are Hutchinson's teeth. So the patients have raggeds, snuffles, Hutchinson's teeth, mulberry molars that are not very high yield, and short maxilla. Saber shins are also there, not very high yield. But Ragged's, Shuffle's, and Hutchinson's teeth are very, very indicative of congenital syphilis. Patients can also have vestibular, they can also get vestibular cochlear nerve damage and CN8 deafness. To prevent, we can treat the mother in the pregnancy. We can give intrapartum penicillin G. Intrapartum penicillin G will treat the treponema and prevent congenital transmission to the fetus. Okay, so that's that. Next one. Next one is VDRL false positives. Now, VDRL is Venereal Disease Research Laboratory. They will detect non-specific antibody that reacts with beef cardiolipin. That is high yield. Okay, beef cardiolipin. And beef cardiolipin is basically the antigen. And if there is reaction, we can say that it's VDRL positive. And one of the highest yield organisms that is positive for VDRL is just treponema. It's so positive that nowadays, not nowadays, VDRL has always been considered to be done for syphilis. It's quantitative, it's inexpensive, and it's widely available. So you can do it in a large mass. If you do a serology testing, there's non-specific and specific. If personally, as far as I'm concerned, you will do the non-specific ones first. That is, you will do these for the screening purposes for syphilis. That is, patients will do VDRL and RPR. If they're positive, then they will do fluorescent treponemal antibody absorption test or treponemal pallidum antigen test. That's what they will do. So these are the two testing. And you can also do a direct test. That is, if you take a specimen and then examine the organism under microscopy, that is dark field microscopy, you will see that there's a spiral shaped organism that's there. Another one is you can do a PCR. Okay. Are we clear about this? Yes or no? Are we clear about syphilis? Everyone, are we clear about syphilis? Okay. Now, let's talk about Jarix-Herxheimer reaction. This is a very high yield reaction over here. Put your stars. Jarix-Herxheimer reactions are basically after an antibiotic is prescribed for a disease, patients will get flu-like syndrome because the bacteria, especially if we prescribe penicillin in case of syphilis, what would happen is when you kill the Treponema pallidum bacteria with the help of penicillin G, when they die, the bacteria, they release a large amount of toxin. So patients, apparently, after you start treating the patients, they actually get worse than they actually get better. And the patients mistaken this worsening sign symptoms for the fact that the doctor might have messed up the treatment by prescribing something which didn't work. But as in general, Jarix-Herxheimer reaction in the treatment of syphilis, we should let the patients know that the fact that they're getting sicker is because the antibiotic is killing the bacteria, and that dead bacteria is releasing toxin, and that toxin is responsible for the new onset of sign symptoms, which possibly means that the antibiotic is working. Okay, which possibly means that the antibiotic is working. This doesn't happen in all types of patients, but it's fairly common. So flu-like syndrome after you treat conditions such as syphilis is due to the fact that killed bacteria release toxins, and that toxin is causing the fever, headaches, and myalgia. So that is Jarix-Herxheimer reaction. This is very, very high yield. Questions will come in the form that they will tell you that you have a patient who was previously diagnosed with syphilis. Now they came to the doctor and they prescribed him penicillin, and now the patient complains of new onset of fever, headache, myalgia. What is the most probable diagnosis? The most probable diagnosis is Jarix-Herxheimer reaction. That is the onset of sign symptoms after you treat them with antibiotic. Is it serious? No, it's not serious. It will subside by itself. Okay. Are we clear about this? Yes or no? Are we clear about this? Jarix-Herxheimer reaction. Yes. Okay. So before we finish bacteria, which are 2 pages, and we want to start with mycology today, Can we take a small 5-minute break before we start with Gardnerella? Yes or no? We will take another break. To be honest, we will take another 10 to 15-minute break after we are done with bacteria as a whole. So instead of taking a long break right now, let's just take a small break for 5 minutes. Let's come back after 5 minutes. Let's finish bacteria, and then let's take a bigger break before we start with fungi. Okay. How does that sound? Does that sound good? Okay. Good. So let's take a break for 5 minutes. 10:47. Let's come back at 10:53. Okay, is everyone back from their break? Is everyone back from their break? Can you guys hear my voice? Okay, are we ready to begin? Okay, so let's begin. So we're done with learning about the spirochetes. We're done with Borrelia, Leptospira, Treponema. Now we will begin with Gardnerella. Vaginalis. Gardnerella vaginalis is a very high yield organism that will be tested a lot of time in your UWorld step 1 and also in your actual exam. This is basically the organism that is responsible for the discharge of uh, gray for the discharge from the vagina. That is a grayish vaginal discharge with a fishy smell. The smell is there's a fishy smell over here and it's non-painful. And the organism itself is very high yield. The organism itself is very high yield for the fact that this is gram variable, meaning that this could either be gram positive or gram negative. So that's not the one in concern. And the shape is also pleomorphic, meaning that it could be of various shapes and sizes. But the important one over here is that the pleomorphic organism, what happens is you have when you have a Gardnerella infection, you have clue cells. You have clue cells. So these cells, as a matter of fact, these are not Gardnerella vaginalis cells. These are these are vaginal epithelial cells. So if you can see over here, it's like a vaginal epithelial cell with Gardnerella accumulation with accumulations of Gardnerella like this, okay, like spots or accumulations of the Gardnerella. And this types of presentation, that is vaginal epithelial cells with accumulations of Gardnerella on the border, this is known as Gardnerella vaginalis. This is known as Gardnerella vaginalis, and this cell is known as clue cell. This cell is known as clue cells, okay? This is a clue cell. Clue cell. This is very high yield and you will get a lot of questions from here. It is associated with sexual activity, but not sexually transmitted. So basically, there's a question that if the wife has Gardnerella vaginalis, do you also have to treat the husband? Yes or no? If it's not sexually transmitted, do you have to treat the husband? You do not have to treat the husband. Only you can only treat the wife because it's a non-communicating disease. It's a not sexually transmitted disease. It's the cause of bacterial vaginosis, which is characterized by overgrowth of certain anaerobic bacteria in the vagina due to decreased lactobacilli. Lactobacilli is one of the normal flora of the vagina. And for any reason, for example, in strong antibiotics, if there is decreased normal flora, then patients are more prone to have Gardnerella infections. And the diagnosis is if a little bit of the discharge is taken, and this is mixed with 10% potassium hydroxide, if there is any fishy smell, which the physician or the diagnostician is not sure about, they can put a little bit of potassium hydroxide, that is 10% potassium hydroxide, and if they add it to the discharge, the smell, the fishy odor smell, will get enhanced. There will be enhancement of the fishy odor smell. The treatment is very easy. Since it's below the abdomen, we can give metronidazole, or we can also give clindamycin. It doesn't matter, but clindamycin or metronidazole can be given. This is Gardnerella vaginalis. Okay. Are we clear about this? Yes or no? Very easy to understand. Next one is chlamydia. Chlamydia. Chlamydia is another organism, which is do you guys remember really chilly and cold? Stay inside because it's really chilly and cold. Okay. For which purpose did we learn really chilly and cold? What was the purpose of us learning really chilly and cold? Obligate intercellular. So what are the organisms that we have to remember with really chilly and cold? Rickettsia, then chlamydia, and and really chilly and cold. Another one, Coxiella burnetii. Very good. So COVID. Okay, okay, typo error. No problem. So it's chlamydia, rickettsia, and Coxiella. Chlamydia cannot make their own ATP. They cannot make their own ATP. They're obligated intracellular, meaning that they will make sure that they live inside the cell. Okay, and in the cell there are two forms in which they can stay. First of all, they can stay as elementary bodies, or they can stay as reticulate bodies. Elementary bodies, these are small, dense, and there's a high yield question that which of these bodies are infectious. Okay, which is eliminate is elementary bodies are elementary bodies more infectious, or reticulate bodies more infectious? The answer is elementary bodies are infectious, and they enter the cell via endocytosis, and they transform into reticulate bodies. So first of all, you have an infection, and then the organism is chlamydia, and after infection, the organism enters the cell via endocytosis. What do we mean by endocytosis? Basically, that if this is the infection and if this is your cell will produce these sorts of cytoplasmic extension, and they will gulp down the organism, and they will make sure the organism enters the cell. When the organism enters the cell, they will cause the infection, and after causing the infection, they will remain as reticulate bodies. Reticulate bodies, they replicate in cell by fission, and they reorganize into elementary bodies. So that's that. So they can stay dormant in the cell in the form of reticulate bodies, and when they want to cause infection again, they can transform into elementary bodies. Always remember this: elementary bodies are infectious, and this is a question. So put your star mark over here. Okay, you have chlamydia trachomatis, or you have chlamydophila pneumoniae, and or chlamydophila psittaci, meaning you can either have chlamydia trachomatis, which can cause adult conjunctivitis for neonatal and adult conjunctivitis, and this is the cause of follicular conjunctivitis. And this can also cause urethritis and reactive arthritis. That's that. And another one is there is chlamydia pneumoniae, which can cause atypical pneumonias, and chlamydophilia psittaci, which can cause psittacosis. Psittacosis is basically this happens when you are in close contact with birds. Okay, in close if you have close contact in birds, especially parrots, they are a very big reservoir for chlamydia psittaci, and this can cause psittacosis, that is atypical pneumonia. So chlamydia has cell wall that lacks peptidoglycan, rendering beta-lactam antibiotics ineffective, meaning that if you prescribe antibiotics such as penicillin or cephalosporins, they will not work for chlamydia because they do not have a cell wall which has peptidoglycan layers. Why? Because they have reduced muramic acid. Okay, this is one question from Amboss. Okay. How will you diagnose chlamydia? You can do a PCR, that is polymerase chain reaction. You can do nucleic acid amplification test, or you can directly look out for cytoplasmic inclusions such as reticulate bodies or a Jim cell. Or you can also do fluorescent antibody stain smear, but that's not high yield. The highest yield one is this one, cytoplasmic inclusions. Cytoplasmic inclusions are the most highest yield. They will tell you that you have a disease, and they will describe the disease. That is, they will tell you that you have a sexually transmitted disease, and then over there you see cytoplasmic inclusions. Okay, sexually transmitted disease showing cytoplasmic inclusions is very indicative of chlamydia. Treatment is azithromycin, not high yield, or doxycycline. If you have to remember a treatment, just remember doxycycline. That should be enough. Okay, that is chlamydia. The questions are, first of all, are they obligate intracellular? Yes. Which type is more infectious? Elementary type. Which form is dormant? Reticulate type. Which one do you see under microscopic investigation? You see the reticulate bodies, which presents as cytoplasmic inclusions. That's that. Can antibiotics such as beta-lactam work? The answer is no. Why? Because the cell walls do not have peptidoglycans. Why do the cell walls not have proper classic peptidoglycan? The answer is due to reduced muramic acid. Are we clear about all the questions and chlamydia? Yes or no? Okay. Okay. Now, Chlamydia, there are types A, B, and C, which can cause chronic infection. A, B, and C can cause African blindness, which is basically conjunctivitis in Africa. Major cause of blindness due to follicular conjunctivitis in Africa. Do we have any students over here from Africa, living in Africa as of right now? Anyone? Anyone? Okay. Okay, no students. Okay, Dr. Jordan, Dr. Uday, how common is chlamydia type A, B, and C for follicular conjunctivitis? I'm just curious. Is it very common? Have you heard of patients? Okay, apparently I'm not sure, but maybe you guys can tell me. Okay, it is there. So apparently, chlamydia trachomatis will cause this will cause is a major cause of conjunctivitis, and especially it's endemic in Africa. So that's that. And it's very widely tested, to be honest, in USMLE Step 1. They test this a lot. Type D and K will cause, so A, B, and C will cause the upper infections. D and K will cause infections in the lower region, that is urethritis, PID, ectopic pregnancy, neonatal. They will not directly cause ectopic pregnancy. What they will cause is, once you have chlamydia infection, the infection gets better with fibrosis. And after fibrosis, if you have fibrosis of the fallopian tube, then after you have the fertilization, after you have the fertilizations, you do not have the implantation in the normal uterine wall. So the fertilization can happen in the fallopian tube, and this can stay in the fallopian tube, and that is a reason for ectopic pregnancy. You can also get neonatal pneumonia with eosinophilia or neonatal conjunctivitis. Okay. Type L1, 2, and 3 will cause lymphogranuloma venerum. This is high yield, extremely high yield. Lymphogranuloma venerum. Lymphogranuloma venerum are small, painless ulcers with painful lymph nodes. You guys remember when we studied syphilis, was the lesion, what was the name of the primary lesion in syphilis? Shankar. Okay. Shankar. Shankar is it painful or painless? Is it painful or painless? Painless. Can you also get lymphadenopathy with Shankar? Is it a painful lymphadenopathy or painless lymphadenopathy? Painful or painless? Painless. Okay. If it's painless, then can we use that to distinguish the lesion for lymphogranuloma venerum, the one that is caused by chlamydia, by saying that the lesion is painless, but the lymphadenopathy is painful. Okay, so can you write down over here that painless lesion with painful lymphadenopathy is chlamydia, and write down over here painless lesion with painless lymphadenopathy is syphilis. Let me know after you guys are done writing this. What I need you guys to write down is painless lesion with painful lymphadenopathy is chlamydia, and painless lesion with painless lymphadenopathy is syphilis. Okay? Are we clear? Did everyone write this down? Okay, good. We are going to skip out on this part. Okay, we will skip this part. We will move forward, but because this is just mindless memorizing, which you guys can do later. After we are done studying bacteriology, we will come back and I'll tell you exactly what you'll do. You can learn this at home, so we're not going to waste our time over here. Okay, we're going to move on to this page. Are we ready? To rickettsial disease and vector-borne illness? Yes or no? Rickettsial disease and vector-borne illness. One of the most highest yield questions you will get from over here is this one. That is, what is the cause of rash on hands and feet, or on palms and soles? What is the cause of rash on palms and soles? There are three bacteria. Before I even begin the discussion of this, I want to discuss this first because this is priority number one. That is, USMLE Step 1 loves to ask the students about the causes of rash on hands and feet. And you need to remember the word CARS. CARS for Coxsackie virus, A. Then you have Rocky Mountain spotted fever. And also we learned that in secondary syphilis, do you guys remember we talked about the fact how there is rash in the abdomen and also rash in the hands? Yes or no? Rash in the abdomen and rash on the hands. Do you guys remember that for the secondary syphilis, right? So along with this, you have Coxsackie A, Rocky Mountain spotted fever, and secondary syphilis. These are the three common organisms for causing rash on hands and feet. Rash on hands and feet. Do not forget this. Rocky Mountain spotted fever, Rickettsia rickettsii, the vector is tick. Despite its name, the disease occurs primarily in South Atlantic states, especially it's more prevalent in North Carolina. The rash typically starts at the wrist and ankles and then spreads to the trunk and the palms and soles. What happens is over here, you have, not only do you have rash, you have fever, rash, and vasculitis. That's the problem. Fever, rash, and vasculitis. Okay, if you have vasculitis, can we assume that there are multiple sign symptoms that you can have depending on which vessel is being affected? Yes or no? Okay, which vessel is being affected, because vasculitis can be more general or specific depending on which vessel it affects. So is it a possibility that if it's a coronary vessel that is affected, patients can have symptoms that is as worse as myocardial infarction? Yes or no? Right? Okay, so if a patient has some sort of a vessel disorder along with fever or rash, then Rocky Mountain spotted fever is what you can imagine. Okay. Okay. Now, if you try to climb a rocky mountain, okay, if you try to climb a rocky mountain, is it going to be difficult or not difficult? Fast answers, please. These are not very legit questions. Just need your answer to see if you guys are participating. It's difficult or not? Yes, the answer is it's difficult. And if it's a very rocky mountain, and is there a possibility you can scratch your hands? Your hands can get scratched when you, okay. So if your hands can get scratched and you're also using your feet to climb, is it a possibility for your feet to get scratched too? Okay. So scratch on hands and scratch on feet for rashes on hands and feet. Now, next one. When you climb a mountain, are you going to feel warmer or are you going to feel cooler? Warm or cool? Warm. So think about that warm for fever. Okay, think about that warm for fever. And isn't there a possibility that when you climb a rocky mountain, you can cut yourself and have bleeding? You can cut yourself and have bleeding, right? So bleeding, does bleeding happen when you rupture a blood vessel? Yes or no? Yes? Okay. So try to think about when you are climbing a rocky mountain. First of all, it's difficult. For difficulty, you use your hands and feet. That's why you have rashes on hands and feet. Then you climb the mountain, you feel warm for fever. Okay. And when you hurt yourself, you bleed. That is, you have vessel damage. So you have vasculitis. So Rocky Mountain spotted fever, think about this story when you cannot remember what are the sign symptoms of Rocky Mountain spotted fever. Are we clear about this? Yes or no? Okay. Now, next one. Next one is typhus. Typhus is endemic. Endemic fleas, known as Rickettsia typhi. An epidemic is caused by Rickettsia prowazekii. These are human body louse, are the vectors. The rash starts and spreading, sparing the palms and soles, but you can also get fever and vasculitis. So that's the main thing. So typhus is basically the same thing, except If it's endemic, it's Rickettsia typhi. If it's epidemic, it's Rickettsia prowazekii. So it's not very commonly tested. The one of the most commonly tested is what is the cause of rash on hands of palm and soles. That's that. Okay. Now we will go back to our video for Anaplasma and Ehrlichia. Okay. And Babesia is not a bacteria, so we will not learn Babesia right now. But we will learn about Anaplasma and Ehrlichia because these are very difficult bacteria to remember. Okay. Is everyone ready for the last video of bacteriology? Everyone ready? Okay. Dr. MS, would you be kind enough to take the last picture? Okay. 1 second. Just give me 1 second.
Welcome to section 44. Welcome to section 45. Welcome to section
Okay, so let's do this.
52 of bacteria. This is our bacteria overview figure, and in this video, we'll be discussing Ehrlichia and Anaplasma, which you can see right here. This scene will take place inside of a hotel room of a family who's on vacation. Right now, we can see an alarm clock on the nightstand, and if you look closely, it says 3:02. It's actually 3:02 in the morning, so you could say it's pretty early. Anyway, early sounds like Ehrlichia. So the alarm clock should help you remember that this part of the image is about Ehrlichia. Next, notice that we've added a redheaded girl that appears to be sick in the other bed. We've shown her in prior images, but recall that she's Anne of Green Gables and is our symbol for Anaplasma. So everything around the alarm clock on the nightstand and bed will be about Ehrlichia, while everything on Anne's bed and nightstand will be about Anaplasma. Any other information in the room will be about both organisms. Okay, with this in mind, let's continue discussing the image. As you can see, we've added two children to the scene who were playing with some blocks when the mean boy decided to destroy it. Look at that grumpy face. I guess he needs to learn how to play nicely with others. Anyway, the destroyed wall is here to help you remember that Ehrlichia and Anaplasma are unique because they do not have a cell wall. Now we've added a pet hamster to the image. You can see that he's securely locked up in a cage, just like both of these organisms are obligate intracellular organisms, so they remain inside of a host cell. Now we've shown the room number to this hotel, which is 2E. The letter E on the east side of the picture should help you remember that these two bugs are common in the east coast of the United States. Next, notice the guy in the other bed who appears to be flustered with this alarm clock. Looks like it started buzzing, so he reached over to stop it when he accidentally knocked over a container of Tic Tacs. You can also see that Anne has some Tic Tacs on her nightstand. I guess both of them want fresh breath when they're sick. Anyway, as you hopefully know by now, this is our symbol for ticks. So these are here to help you remember that Ehrlichia and Anaplasma are transmitted by the Ixodes deer tick. This is an image of the Ixodes deer tick, and this is a vector for both Ehrlichia and Anaplasma. Also notice that both the guy and Anne look pretty sick. They both are laying in bed and have thermometers in their mouth. This is here to help you remember that Ehrlichia and Anaplasma cause non-specific flu-like symptoms. As you can see, they're both laying in warm, comfy beds with black blankets. The blankets look very clean and are without blemish. Just like the black horses we showed in our Coxiella video, the clean black blankets are here to help you remember that a rash is uncommon in both Ehrlichia and Anaplasma. Alright, up to this point, the two organisms have been very similar, but now we're going to discuss the key differences. Notice that we've added a balloon next to the alarm clock. I guess someone got him a get well balloon in an attempt to comfort him. We use this balloon in our Salmonella typhi image to represent monocytes, because the balloon kind of resembles a monocyte. So the balloon is in this image next to the alarm clock, to help you remember that Ehrlichia may be seen in the cytoplasm of monocytes on a peripheral blood smear. This is an image of Ehrlichia, and you can see the organism in the cytoplasm of a monocyte, as indicated by the black arrow. Also notice that Anne has a sandwich in her hand and that there are a bunch of grain crumbs on the bed. Grain sounds like granulocyte. So these grain crumbs are here to help you remember that Anaplasma may be seen in the cytoplasm of granulocytes on a peripheral blood smear. This is an image of Anaplasma and you can see the organism in the cytoplasm of a neutrophil, indicated by the black arrow. As a reminder, neutrophils are granulocytes, but so are basophils, mast cells, and eosinophils. So anaplasma may be seen in any of these cell types. Finally, notice that we've added 2 dirt bikes next to the door. I guess they were planning on using these on their fun vacation, but they may not get a chance to considering how sick they both are. As you should know by now, a dirt bike is our symbol for doxycycline, so we've included these in the image to help you remember that Ehrlichia and Anaplasma can be treated with doxycycline.
Okay, so did you take the picture, Dr. MS? Okay, good. Now, okay, so I need you guys to write down one thing. First of all, I need you guys to remember this word, megaberry, megaberry, because you will have a lot of high yield step 1 questions that will try to separate the good students from the best students by asking you these types of questions. That is, which bacteria stays inside monocytes? The answer is Ehrlichia. Which bacteria stays inside granulocytes? The answer is Anaplasma. Which bacteria stays inside macrophage? What is the answer? What is the answer? Which bacteria stays inside macrophage? No, macrophage. We just learned this. We learned this. Why will salmonella stay inside macrophage? Okay, salmonella will not stay inside macrophage. Do you guys remember Bruce Wayne loves to eat mac and cheese? Bruce Wayne loves to eat mac and cheese. With that, we have said that macrophage, the organism is Brucella. So 3 types of cells and 3 types of organisms. If you can remember this, that's more than enough for Anaplasma and Ehrlichia. And also the tick. The tick is the one which is the vector. So Anaplasma and Ehrlichia, for a fast revision, just look at megaberry. Mega for monocyte, Ehrlichia, granulocyte, Anaplasma, macrophage, Brucella. Okay. Next one is Q fever, Coxiella burnetii. It's also an obligate intercellular, no arthropod vector. Spores are inhaled from cattle, sheep, amniotic fluid. This presents with headache, cough, influenza symptoms, pneumonia, possibly in combination with hepatitis. Do you realize how pneumonia, headache, cough, influenza, these things are not very specific to any organism? This can tell you that the organism can be multiple organisms, yes or no? Okay, so you do not have to worry about Coxiella burnetii in terms of trying to diagnose this condition by looking at the sign symptoms, because the sign symptoms of Coxiella burnetii will overlap with a lot of other sign symptoms. The only thing that is very distinctive of Coxiella burnetii is this is a common cause of culture negative endocarditis. If you know how we have endocarditis with Staph aureus and IV drug users, Staphylococcus epidermidis and immunocompromisation or previously damaged valves. Then we have Vibrio parahemolyticus for hemochromatosis, Streptococcus bovis for colon cancer. We can also get Coxiella burnetii endocarditis. And if there is endocarditis, that is, for example, you have right atrial enlargement due to tricuspid valve involvement. And after that, if you think that the patient has endocarditis because the patient has murmur along with fever, but you do a blood culture and you see that there you cannot find Staph aureus, epidermidis, bovis, or Vibrio parahemolyticus, the next organism which I want you to think about is Coxiella burnetii, because it's the common cause of culture negative endocarditis, and this is the most common. This is the only thing that you have to focus over here. Q fever is caused by a quiet, complicated bug because it has no rash or vector. So this presentation, that is headache, cough, fever, and pneumonia and hepatitis, this is called Q fever, but I never really found any question about Q fever because it's extremely difficult to make a question about this because the sign symptoms will overlap. So that's all for Coxiella burnetii. Okay. Now, last one is Mycoplasma pneumoniae. Mycoplasma pneumoniae is one of the most common cause of what we say is walking pneumonia. Do you remember that one time when you were walking in the market, you came back home, and then all of a sudden you started coughing and you ended up with like a pneumonia or something? Yes or no? Because it's pretty common. It happens from time to time. Yes or no? When you just come back home from a crowded place, there are a lot of people who ends up with a fever and cough, with a fever, cough, shortness of breath, right? That is because they were infected with what we call is mycoplasma pneumoniae, because it's one of the most common cause of atypical walking pneumonia. Insidious onset. The onset is insidious. The headache, non-productive cough, patchy or diffuse interstitial infiltrate. What Dr. Jordan has just said is that the X-ray is sicker than the patient. What she means is basically the sign symptoms are not that very. You might think that the patient is doing okay, that the patient only has a fever and a mild respiratory infection, right? But when you do an X-ray over here, the X-ray looks worse than actually how the patient is, because over there in the X-ray you will see that there is multiple diffuse infiltrates, and and there are multiple opacities and reticular opacities, and what this does is this causes more damage to the lungs, but this actual sign symptoms are actually not that bad. So the thing is, these patients, when you do an X-ray and you see that the patients, they have a mild fever and mild cough, but the X-ray looks really bad, then think about the fact that you're dealing with a mycoplasma infection, and this should be treated immediately. So the X-ray looks worse than the patient. High titer of cold agglutinins. This is another one, IgM. This is another high yield question that you can get over here. Okay, which can agglutinate RBCs. So you call IgM, there's IgM. You can also get IgM positives. The treatment is with the macrolide or doxycycline or fluoroquinolones. Fluoroquinolones. Okay, penicillin, mycoplasma. Do they have a cell wall? No. If they do not have a cell wall, can you give penicillin? No. Okay. Which other organisms can you not give penicillin? Which other organisms can you not give penicillin? Anaplasma, uroplasma, rickettsia, then chlamydia. Okay, very good. So these are all the organisms which lacks cell wall. This is not seen on gram stain because they do not have a cell wall, so they will not stain properly. Pleomorphic bacterial membrane contains sterols for stability. Okay, this is one question from Amboss, that is mycoplasma. Instead of having peptidoglycan, they have steroids on the, they have sterol-like structures on the cell membrane. So that's that. And they will grow on Eton's agar. We talked about this already. Mycoplasma gets cold without a coat, no cell wall. This causes atypical variant of Stevens-Johnson syndrome. Stevens-Johnson syndrome is basically a severe form of rash, right? And this can happen with mycoplasma pneumoniae. We talked about this in dermatology. And this is typically in children and adolescents. They're more common. Okay, so what are the things that you have to focus on for mycoplasma pneumoniae? Well, the things that you have to focus on is the insidious onset of pneumonia after coming home from a crowded place. That's number one. Another one is X-rays worse than the patient. Basically, the patient will have a mild presentation, but the X-ray will look hideous. So that's that. And another high yield question that you will get over here is with the cold agglutinins, that is IgM, which can agglutinate RBC. So in mycoplasma pneumoniae, IgM is positive. And then you can also, they also have one or two questions about Eton's agar, that whether you know that mycoplasma grows on Eton's agar or not. And for Amboss, you have one question, that is, you have the sterol groups on the cytoplasmic membrane except the peptidoglycans. That's that. Okay. Did you guys underline everything? Yes or no? Okay. So with that being said, we are done with bacteriology. Are we clear? We are done with bacteriology. So how do you guys feel? Bacteriology. We're done with this. How do you guys feel? Okay. You must feel like you have accomplished something, and you have every right to feel that way. So congratulations. Bacteriology is not a small topic to finish, but if you have been doing the homeworks properly, that is going home and instead of doing questions, you are reading the chapters and trying to memorize what we have said, then you have finished you have finished bacteriology perfectly. Okay, just because you're done with the lecture, that does not mean you have perfected bacteriology. If you have to perfect it, you have to do the homework. Okay, so with that being said, since we are done with the bacteriology, are we ready to take that break and come back and start with mycology? Yes or no? Okay, are we clear? I'm going to try to see if I can finish mycology today. Okay. I'll try to finish mycology. I'm not sure if I can, but I will try my best. Okay, are we clear? So exotic is vectors for 4 bacteria. It's a vector for Rickettsia, Anaplasma, Ehrlichia, mainly. Okay, and Lyme disease. Well, to be honest, exotic is more for Borrelia than for like anything else. Okay, exotic is more for Borrelia, but you have some questions from Anaplasma and Ehrlichia, so that's that. So yes, 3 or 4 bacteria, that's what exotic is responsible for. Okay. Okay, so can we take that break and come back after 10-15 minutes and see, let's see if we can finish fungal. Let's see if we can finish mycology today. If not, then we will do it tomorrow, obviously. Okay. How long do you guys want to take the break? 10-15 minutes or shorter? 15 minutes. Okay. So let's come back after 15 minutes at 11:45 to 11:50, and let's start. Let's see if we can finish mycology today. Okay, is everyone back from their break? Is everyone back? Can you guys hear my voice? If you guys can I get a yes on the chat box? Okay. Okay, so can we begin our discussion on mycology? Yes or no? Is everyone ready to start the discussion on mycology? Okay. Okay, so we are going to start talking about systemic mycosis. Systemic mycosis basically is okay. This is basically your funguses, which are basically responsible for causing pneumonia. If very simply put, that is respiratory tract infecting fungi. Respiratory tract infecting fungi, and all types of fungi. Well, what they have is they have a tendency of forming what is basically they can form small granulomas. Okay, they can form granuloma like structures. So whenever we say granulomas, I know that whenever you say granuloma in the lungs, you start thinking about tuberculosis or sarcoidosis. But it's also important for you to consider that there's a possibility that if the patient is immunocompromised, then granulomas in the lungs could also indicate systemic mycosis or fungal lung infection. So, before we begin, let's talk about the fact that fungi can actually be dimorphic, meaning that if they survive in the cold, okay, if they survive in the cold, the form that they take is a mold, mold, mold. So, mold in the cold, the temperature is around 20 degree Celsius. And if they survive in the heat, does anyone know what form of fungi survives in the heat? Very good. It's yeast. Mold in the cold and yeast in the heat. Yeast in the heat. The heat is basically the temperature of 37 degrees Celsius. Okay, so that's that. For all types of fungal infections, that is the fungal infections of the lungs that which we are going to discuss, the treatment is more or less the same. The treatment for all types of infection is you can treat them with fluconazole or itraconazole. Fluconazole or itraconazole. Okay, that's that. Now, let's talk about our first fungi. We will talk about 4 fungal diseases, and we will talk about them depending on their locations. Their locations are the ones where the fungus is endemic. Okay, so location wise, if they tell you that this is the location of the patient, or this is where the patient is coming from, and it's a hint that it's a fungal infection, you can directly have your answer right then and then. So the locations are very important. The first disease that I want to talk about is Histoplasma capsulatum or histoplasmosis. Histoplasmosis. Histoplasmosis, okay, believe it or not, but the only thing about histoplasmosis, majority of the questions you can get right with histoplasmosis by looking at where they are coming from or where is the patient coming from, meaning the endemic area of histoplasmosis. The endemic area of histoplasmosis is Mississippi. Mississippi. Okay. Have you guys watched Friends? Does anyone watch Friends or have watched Friends? Okay. No one has watched Friends. Kind of judge you guys, to be honest. Okay, Dr. Hassan, Dr. Dahlia, Dr. Okay. Okay, do you guys remember how Ross counted with one Mississippi, two Mississippi, right? Mississippi. Okay, next one is Ohio. Another one is Bat Caves. Bat Caves. Suntan. Yes, that's correct. So Mississippi, Ohio, Bat Cave. Bat caves are basically caves where bats are there, right? The bat cave. So Mississippi and Ohio, that's that. Okay. So histoplasma, they are more endemic in Mississippi, Ohio, and bat caves. And they will tell you that you have a patient who comes to you with fever, cough, night sweats, weight loss, coming all the way from Mississippi or coming all the way from Ohio, or had a recent visit to a bat cave. What is the most probable diagnosis? The endemic area, Ohio, Mississippi, and bat cave. This will tell you that the diagnosis is histoplasma capsulatum. Now, another thing is histoplasma, they love to stay inside macrophages. Which other organism did we learn a while back, which also loves to stay inside macrophages? Brucella, very good. Brucella also stays inside macrophage, and histoplasma stays inside macrophage too. Sign symptoms of histoplasmosis is you can get pneumonia, tongue ulcers, splenomegaly. We'll talk about this when we go to first aid. Let me just talk about some of the majority of the key things that will be asked over here. So histoplasma will subside in macrophages. So basically, you can have questions where they can tell you that you have a patient with fever, cough, night sweats, weight loss, abdominal pain, and the patient had a recent visit to Ohio or is coming from Ohio, or recently went to Mississippi, or recently had a travel to a bat cave. What is the most common, which type of organism will you see and where will you see that organism? The answer is you will see histoplasma and you will see it in macrophages. So they love to stay inside macrophages. Okay, so looks actually, it actually looks something like this. For example, if this is a macrophage, okay, a histoplasma, they will, for example, this is the histoplasma. This is how they will look like this. Macrophage infected with histoplasma. Okay, so that's that. Next one. Next one is blastomycosis. Next one is blastomycosis. Okay, also very high yield. Blastomycosis. The highest yield factor about blastomycosis, before we talk about the endemic areas, is how it looks under under the microscope. So B for blastomycosis and how it looks under the microscope is very important because they use this to make the questions. That is, they have a broad-based budding. They have a broad-based budding, broad budding yeast, broad-based budding. The size is almost the same as a red blood cell, but they have a broad-based budding over here. Okay, this is high yield. And then the area. The area where blastomycosis is more common is in the Great Lakes. Great Lakes. Great Lakes is not any lake which is great. Great Lakes is the name of an area. Okay, Great Lakes. And Eastern and Central USA. Central USA. Okay, Eastern USA, like from where we are from, right? Exactly, Minnesota area. Then you could also have them from New York, New Jersey, Connecticut, and all of these places. So blastomycosis over there, these are more common. So blastomycosis, what they do is not only do they cause lung diseases, blastomycosis also involves the skin and they cause verrucous skin lesions. Skin lesions, they're varicose lesions. So I'll show you the lesions in 1 minute. Okay, now let's talk about coccidioides immitis. Coccidioides immitis. 1 second. Okay, let's talk about coccidioides immitis. Coccidioides is responsible. Coccidioides immitis is responsible for coccidiomycosis. Okay, coccidiomycosis. And once again, the area is very high yield. Um, the area, first of all, we're talking about coccidioides immitis. The area is very high yield because the questions will come according to the fact that where the patient is coming from. The area is Southern America. I mean, Southwestern America. So Southwestern US and California. So Southern Americas, basically, that's where the patients are going to come. Southern USA or California. Okay. Okay. Now, the feature, there's another thing. The feature is over here, if you do a peripheral, if you do a microscopy and you want to visualize this fungi appears in the blood in comparison to the size of an RBC. For example, if this is the size of your normal RBC, the biconcave shape of the RBC, this fungi loves to loves to survive in spherules by forming small endospores. Millions and billions of endospores together, they clump together inside a big spherule, and that's how they represent themselves in the blood. Okay. Once again, they are responsible for causing fungal pneumonia. Then they are responsible for causing another thing, just as how blastomycosis was responsible for causing pneumonia and varicose skin lesions. Coccidiomycosis was responsible for causing pneumonia. Along with this, they can also have joint pain, that is arthalgia. They can cause meningitis. Another one is they have another skin lesion, that is they cause desert bumps. Desert bump is known as erythema nodosum. Erythema nodosum. They form desert bumps on skins. Okay, so this is known as erythema nodosum. Okay, next one. This disease is actually pretty common, to be honest. Okay, this is actually pretty common. Spherules containing endospores. Spherules containing endospores is very it's one line in UWorld which will indicate you to coccidiomycosis, coccidioides. Next one is paracoccidioidomycosis. Paracoccidioidomycosis. Okay, paracoccidioidomycosis is common. So I'm just gonna write over here. Paracoccidioidomycosis. Paracoccidioidomycosis. This is more common in Latin America. Okay, Latin America is more common. For example, in the regions of you have Brazil and you have Argentina and all of those places. They are more common in paracoccidioidomycosis. Okay, so Southern America and Mexico, so that's also there. So what happens is this is very easy to diagnose because this has an appearance of a captain's wheel. Captain's wheel, basically, this looks like this. Okay, this is very easy to diagnose because this has a look, which, for example, if this is the wheel of captain, okay, this, for example, the captain's shield, right? This looks like this, the buds. They have a captain's wheel appearance. Okay, this is how they look like, and this is one of the most highest yield thing you can learn about paracoccidioidomycosis is two things basically from Latin America, and this is how they look. They look like a captain wheels appearance. Okay, it's like a captain shield appearance. Okay. Having said that, I'm not gonna make you guys watch the video of histoplasmosis, blastomycosis, but what I will do is to make sure that you guys are learning this appropriately. Just gonna show you the pictures, and then I'll move forward. Okay, 1 second. Okay, so this is the picture mnemonic for Histoplasma capsulatum. Over here, the one thing I want you to remember, okay, the one thing I want you to remember is this one. This shows a bat cave. So remember this picture for the bat cave over here, that the histoplasma is common in bat caves. Then this guy over here sitting with the letter Ohio State to help you remember that Ohio, that it's more common in Ohio. Okay, Granny for granuloma, Granny for granuloma, and birds in a cage. Cage, physio uses cage to represent. Can anyone tell me? Let's see how smart you are with physio. What does physio use the word cage for? Macrophage. Very good. So physio used the word cage for macrophage, and this shows birds inside the cage, showing that the fungus is inside the cage, meaning fungus is inside the macrophage. Okay. And so that's all I want you to remember from this one over here. This is for Histoplasma capsulatum. Okay. Next one I want to show you is for blastomycosis dermatitis. Okay, 1 second. Okay, this is for blastomycosis dermatitis. Blastomycosis dermatitis is there's a huge blast over here, which will help you remember that this is for blastomycosis. This is a lake showing the Great Lakes where it's more common. Two bombs together showing that it is broad-based budding, and this will help you show that there are verrucous skin lesions. Verrucous skin lesions are there. Okay. And once again, this tattoo on the army's hand showing a granny is for the fact that they form granulomas. Okay. This is what you can remember, and you won't forget about this when you uh, learn or come across the questions again. Next one is coccidioides immitis. Coccidioides immitis, as we said, that this is in Southern America. I mean, Southwestern America. So around the area of Arizona, that's there. They used a silver bullet and a silver gun to help you remember that silver stain is used to stain coccidioides immitis. Do you guys remember that? Do you guys remember how I mentioned that we use silver stain for coccidioides, and it's one of the most important things? And can anyone tell me what other organisms we can stain with the silver stain? Coccidioides immitis, except coccidioides. What other organisms? Pneumocystis, very good. And Helicobacter, the last one. Last one is with an L, Legionella. Very good. CPHL. Okay. So silver stain. Okay. So do you see how there's a granny over here? This shows granuloma. Then we talked about desert bumps on the skin, erythema nodosum. This will help you remember that's erythema nodosum. And this one over here, popped up balloon, this will help you remember that that there are spherules containing endospores. Spherules with endospore. This balloon is so packed with this balloon is so packed up with the confetti is that it bursts. So spherules are so packed up with the fungi is that they can burst up. So this is spherules containing endospores. That's all you have to remember, nothing more than that. Okay. Last one is Paracoccidioides brasiliensis or Paracoccidioidomycosis. Okay. Captain America over here with this captain's wheel will help you remember that this is Paracoccidioides. Okay. This insect-like creatures will help you remember that it's a dimorphic fungi. And over here, the flag of Brazil will help you remember that this is more endemic in Latin America. That's all. That's all you have to focus on. Just focus on the captain's wheel, Latin American flag, for the fact that it happens in Latin America. Okay, and just look at the shape of the of the of Captain America's shield. This is the shape of Paracoccidioides immitis. Okay, are we clear about this? The first four fungi, everyone? Okay. So, Histoplasma capsulatum, where is this more common? Histoplasma capsulatum, where is it more common? Okay. Blastomycosis, where is it more endemic and common? Blastomycosis. Great Lakes, very good. Coccidioides immitis. Okay. Paracoccidioides immitis. Okay. So let's read, see if we have covered everything. Okay. So is there anything that you can leave out from over here, from this small table? Is there anything that you can skip? No. So everything from this table is important. Okay. Systemic mycosis, they can cause pneumonia and disseminate. They remain as dimorphic fungi. Dimorphic fungi means they have the ability to change their morphology under different types of environmental circumstances. For example, in the cold, they can be mold. In the heat, they can be the yeast. Only exception is coccidioides because it's a spheruole, not a yeast. So that's that. Okay. Symptoms confusing, similar. Okay. Let me tell you, Histoplasma capsulatum, blastomycosis, coccidioides immitis, and paracoccidioides. In all of those things, will you have pneumonia and granuloma? Yes or no? Okay. Which one will have pneumonia with varicose skin lesion? Pneumonia with varicose skin lesion, blastomycosis. Which one will have pneumonia with desert bumps? Desert bumps. Okay. Now it's a bit more simpler. Now the sign symptoms should be a bit simpler. Histoplasmosis. Histoplasmosis is more common in Mississippi and Ohio. You can find macrophage with histoplasma, and you will get granulomas along with tongue ulcers and splenomegaly. So splenomegaly with tongue ulcers, splenomegaly with granulomas and pneumonia. That's that. Histohides with the macrophage. It is associated with bird droppings or bad droppings, and it is diagnosed via serum antigen in the urine. Okay, that's that. But it's not very high yield. They don't really ask you that, so don't worry about it. They'll ask you about the location. Blastomycosis is more common in the Great Lakes and eastern state US. Broad-based budding is very important for blastomycosis. And blastomycosis will cause varicose skin lesion, inflammatory damage, disseminated to bones and skin, which may look like squamous cell carcinoma, but it's not. It is varicose skin lesions. They form granulomatous nodules, varicose skin lesions. Coccidioides immitis can also cause skin lesions, but those skin lesions are different because over here this looks like papillomas, verrucous, right? But over here, the one for Coccidioides immitis, what they will have is they will have desert bumps, erythema nodosum. They will look like bumps on skin, not verrucous skin lesions. So granuloma with erythema nodosum or desert bumps is more common for Coccidioides immitis. Along with this, it can also cause arthalgia, right? It is associated with dust exposure in endemic areas, and it's more common in southwestern US and California. And over there, you will find that there are spherules of Coccidioides immitis, which is which is bigger than RBC, and these spherules are filled with RBCs over here, like this. That is Coccidioides immitis. Then the next one is Paracoccidioides brasiliensis. The word Paracoccidioides brasiliensis it will help you realize that this is more common in Latin America, for example, in the regions of Brazil, Argentina, Mexico, Guadalajara, and then you have some other Latin states. So over there, it's more common. The sign symptoms are not very high yield because you can get pneumonia with granuloma-like appearance, but the location is high yield and the shape. Look at the shape of the fungi. This is very distinct for Paracoccidioides. Okay, is everyone clear about this? The first four fungi. Yes. Okay. Can we move on to this one? Cutaneous mycosis. Okay. Cutaneous mycosis. Very easy and very easy to understand. Extremely easy to understand because this is a very common type of infection and presentation. Cutaneous mycosis means the mycosis that will stay superficially. And the most superficial thing we have is the skin, right? So fungal skin infections. These were fungal lung infections. These are fungal skin infections. This is systemic. This is cutaneous. Cutaneous means superficial. Number one is tinea. Tinea are dermatophytes. This is a clinical name for dermatophytes, meaning cutaneous fungal infections. Dermatophytes include microsporum, trichophyton, epidermophyton. Epidermophyton, microsporum, and trichophyton. These are the names of the dermatophytes, and this is high yield for NBME. You have to know the names for NBME. Microsporum, trichophyton, and epidermophyton. Do you guys remember? Okay, is this the first time you guys are studying mycology? You just don't know? No. So in order to diagnose cutaneous fungal infections, are you aware that we do the potassium hydroxide test from the skin? We take a small sample from you. We take a small sample of your skin, and we put a little bit uh, of potassium hydroxide, which can get rid of the dermal structures, and this will help you visualize the fungal better. If you see a branching septate hyphae, then you are dealing with a dermatophyte. So branching septate hyphae, which is visible on potassium hydroxide skin, and blue fungal stain like this. This will show the septate hyphae, as you can see over here. This is the hyphae with this angular septum. It is associated with pruritus, meaning that it is extremely itchy. So that's that. Okay. The next one is tinea capitis. Now, the names are going to change according to the location at which it affects. If it's on the head, the where we wear caps and hats and cap. So hats and cap for tinea capitis, which happens on the head and scalp. It is also associated with lymphadenopathy, that is cervical or lymphadenopathy, not very common. Alopecia and scaling, as you can see in this man over here, that he has severe tinea capitis. Okay, this region of hair loss along with scaling. This is for capitis. Corporis is the one which happens on corporum. Corporum is the Latin word for body or torso. So corporis. Corporis is tinea corporis, which happens on the body. It is characterized by enlarging erythematous, scaly ringworms with central clearing. As you can see over here, there's a central clearing in the middle, and the worms are forming a ring like this. So this is tinea corporis. Then you have tinea crudis. Tinea crudis happens in the crural region, also known as the inguinal region. That is in between the crease. Remember the word skin crease for crura. So in the inguinal region or crease region. Then you have pedal region or tinea pedis. Okay, that is in between the toes of the feet, right? You have interdigital, that is most common. Then you can also have moccasin type, and you can also have vesicular type, but this is more high yield. Okay, that's that. Another one is tinea unguium, meaning that this is basically onychomycosis. That is the one that happens in the nails. Unfortunately, they do not have a picture of this, but it's a fairly common onychomycosis. Okay, now next one is caused by Malassezia furfur, or this is also called tinea versicolor. Don't confuse tinea versicolor with dermatophytes. Dermatophytes is just tinea. That's why I personally do not prefer calling this disease tinea versicolor. I would rather call this pityriasis versicolor caused by Malassezia furfur or Malassezia species. Malassezia species are the superficial fungi that are responsible for causing this disease. It's a yeast-like fungus, and what it does is you will see a lot of patients, if not, you will see a lot of people in your family members with these type of skin infections of hypopigmented areas. Okay, have you guys seen people like this before? I've seen so many people in my friends and family, more so in my friends, um, especially their skin. If they do not take good care of it, I have personally seen them, the areas of hypopigmentations, and sadly, these are fungal infections. It's a fungal infection where the fungus, that is Malassezia species or Malassezia furfur, is the name of the fungus. I love saying that word, furfur. Okay, Malassezia furfur. What they do is they cause degradation of lipids in the skin. So the skin have sebum. The sebum have the lipids, and they will degrade those lipids, produce an acid that inhibits tyrosinase. And we know tyrosinase is responsible for conversion of tyrosine to melanin, and melanin is responsible for giving the pigmentation to your skin. So if tyrosine cannot convert to melanin, then you cannot have proper pigmentation. Thus, you have areas of hypopigmentations. So degradations of lipids will help you give an acid which prevents the action of tyrosinase. As a result, you have decreased melanin synthesis and hypopigmentation. You can also get areas of hyperpigmentation or pink patches. That's not that high yield. Okay, there's another thing that is high yield. Is I want to talk about this one. Okay, that is, if you take a small amount of sample from over here and you visualize this under a microscope, this has a classical spaghetti. Uh, this has a classical spaghetti and meatball appearance. Have you guys ever eaten spaghetti and meatball? Like a bowl of spaghetti, right? And big meatballs. It's a very common dish over here in New York, more or less. It's more so common in Italian American population. Spaghetti and meatballs. This is how it looks like. Meatballs and spaghetti. Meatballs, spaghetti. Okay. So this is very common for Malassezia furfur. Okay. Treatment. Treatment is selenium sulfide or topical antifungal medication. Selenium sulfide will prevent the growth, and topical antifungal medication will kill the bacteria, will kill the fungi. That's all. Okay, that's all you have to remember from over here. Okay, are we clear about this? Yes or no? Okay, can we move on to the next fungi? Okay, do you guys want to take a small 5-minute break before we jump into this fungi so that we can finish it? We only have 2 more pages. Okay. Do you guys want a break or no? Or do you guys want a break later? If not, then that would be great. Break? Okay. Okay, let's take a 5-minute break then. Let's come back at 12:30 and we can finish mycology today. That would be great. And then tomorrow we can finish parasite, and hopefully by the day after we can be done with microbiology. Okay, is everyone back from their break? Can you guys hear my voice? Are you guys back from your break? Okay, so let's begin. Is everyone ready? Shall we begin? I'm going to start talking about Candida albicans, one of the most important fungi there are. Okay, so let's start with Candida. Candida, as we all know, is an opportunistic fungi. Okay, it's an opportunistic fungi means that it takes the opportunity of its growth when the surrounding is devoid of normal flora. So this is basically they form pseudohyphae and budding yeast at 20 degrees Celsius, and they form germ tubes at 37 degrees Celsius. This is something which I want you to focus on a lot, meaning that they look like this at 20 degrees Celsius. They look like this. That is, this is the look for pseudohyphae. This looks like a hyphae, but it actually is not. Okay, so pseudohyphae and budding yeast. So as you can see, this forms, and then at top you have a yeast over there. So this is a budding yeast, and another one is this is how it looks like at 20 degrees Celsius. This is a very high yield picture, and this is how it looks at 37 degrees Celsius. That is, they form germ tubes. These tubes basically with the central, right, with this sort of a budding, this is how it looks like at 37 degrees Celsius. They can either form systemic infection or superficial fungal infection. They are the most common causes of oral and esophageal thrush in immunocompromised patients or neonates or patients have receiving steroids or diabetes or they have AIDS. They can also cause vulvovaginitis, diabetes, diaper rash, endocarditis, and IV drug users are more so common. And especially, this is something which I need you to focus on. I have already discussed this while we were doing our UWorld notes. That is, if there is a patient who lacks neutrophils, neutropenia, in severe neutropenia, you will have systemic candidiasis in neutropenic patients. This is very common, and you will get a lot of questions regarding this. This is also responsible for causing chronic mucocutaneous candidiasis, the immunodeficiency disorder due to the absence of the autoimmune regulator gene. Do you guys remember that? AIRE gene? And how if it's absent, there's no T cell growth and differentiation. As a result, you have candidiasis. Treatment is very simple. For oral medications, you can give them fluconozoles or topical azoles for vaginal infection. For superficial infection, you can give them nystatin, or you can also give them echinocandin, but nystatin is more commonly used, right? And for systemic disease, you can give them amphotericin B. Amphotericin B. Okay. Don't worry about learning the drugs right now. We can learn the drugs later. Just try to understand the questions. What type of questions are going to come? Okay, so question number one, pseudohyphae at 20, germ tube at 37. That is one type. Then systemic neutropenic patients can get systemic candidiasis. That's another one. And another one is no, that's it. These are the two that's high yield. Okay. Okay. Next one is Aspergillus fumigatus. Okay, Aspergillus fumigatus. These are septed hyphae that branch at 45-degree angle. Okay, the difference between this and mucor, I want you to see right away, is mucor is non-septed hyphae that branch at wide angle. This is something which USMLE will try to see whether you can distinguish properly between aspergillosis and mucormycosis. That is, in mucormycosis, you have mucor, you have mucor, which is non-septed and it branches at wide angle, as you can see over here. That this is mucor, which has a wide angle branching. As you can see, this angle is pretty wide. Okay, and the one for aspergillus, okay, the one for aspergillus, as you can see, that the angle at which it branches is pretty narrow. So if you can draw an angle over here, you'll see that this angle is actually smaller than this angle. So narrow angle budding for Aspergillus and broad base budding for mucor. That is something which you have to focus and put your attention to right away. Another one is it's septate. This is non-septate. Okay, well, let's get back to Aspergillus. This can cause invasive aspergillosis in immunocompromised patients and neutrophilic dysfunctions. This can cause aspergillomas, right, in pre-existing lung cavities, and especially after TB infection. After tuberculosis infection, there is a more higher chance of having aspergilloma. So I'm going to put my star one over here, one over here. Okay. Okay. Another high yield star, which I'm going to put, is for aflatoxin. Aflatoxin is basically a toxin that is produced by Aspergillus. Okay. Can anyone tell me what type of carcinoma will aflatoxin cause? Not sure if you saw what was written over there. Right. Okay. It causes hepatocellular carcinoma, aflatoxin. Treatment is you can treat them with voriconazole or echinocandins. Okay, I'm not going to put this here because we'll learn about the drugs later. Another one is what type of lung lesion will aspergillosis cause? Let's see if you guys remember from respiratory pathology. What type of lung lesion will aspergillosis cause? Nope, that's not what I'm looking for. Nope. Anyone else? No. What type of lung lesion? Lung lesion. Do you guys remember we talked about the fact how allergic bronchopulmonary aspergillosis is one of the most major presentation of bronchiectasis? Post bronchiectasis. Very good. Bronchiectasis. Do you guys remember that? What is bronchiectasis? What is bronchiectasis? Dilatation. Dilatation of what? Dilatation of alveoli is not the right answer. Dilatation of alveoli is not the right answer. Okay, what happens to the, okay, let's think of this from a basic science point of view, okay? Because to be honest, from your answers, you guys do not sound very confident about your knowledge regarding bronchiectasis, or either if you do, you're not willing to share them. Either ways, in bronchiectasis, what happens to the cartilage in bronchiectasis? What happens to the cartilage in bronchiectasis? Is it destroyed or not destroyed? Okay, if the cartilage in if the cartilage in the bronchioles, if they are destroyed, will the lung bronchi, will they constrict or dilate according to changes? Yes or no? Okay. So destruction of cartilage. Do you guys remember what we talked about this in respiratory pathology? The bronchiectasis is due to recurrent lung infection. As a result, there is growth of the bacteria, which can cause destruction of the lung of the bronchial cartilages. This is something which I put a lot of discussion in because most of the aspergillus questions are connected to respiratory pathology. Okay, they will ask you about aspergillosis, but they'll take the question away to respiratory pathology. Okay, so make sure that you guys remember that aspergilloma or aspergillosis will cause bronchiectasis. It's a allergic bronchopulmonary aspergillosis is a hypersensitivity response to aspergilloma growth. I mean aspergillosis growth in lung mucus, and it is associated with asthma and cystic fibrosis. So that's that. Okay. So are we clear about candida and aspergillosis and aspergillus? Yes or no? Are we clear about candida and aspergillus? Okay, so narrow-based budding septate hyphae. Which fungus is this? Narrow-based budding septate hyphae. Which fungus is this? Blastomycosis is broad-based budding. Please don't confuse that. Blastomycosis, B for blasto, B for broad-based. I said narrow-based budding for aspergilloma. Germ tubes. Which fungus forms germ tubes? Germ tubes at 37 degrees Celsius. Candida. Which fungus forms pseudohyphae? Pseudohyphae. Rhizopus is not the correct answer. It's the incorrect answer. Pseudohyphae is formed by Candida. Okay. Okay. No. Okay. So yes, hypersensitivity is associated with aspergillosis. Okay. Now, before I jump into Cryptococcus neoformans, Cryptococcus neoformans is extremely. I mean, if there's one fungus which you can expect, let's say there are 5 questions in step 1 from fungi, 3 out of 5 questions should be from Cryptococcus neoformans because that's how important this is. Okay, just for the fact that it's so important, we'll watch a physio video on this one, and we'll make sure that we learn everything about Cryptococcus neoformans. And we will not watch any more video for mycology or for today. That's the only video that we will watch, and hopefully we can finish the rest of the topics without the videos. Okay. So do you guys find the videos helpful or not helpful? But I'm not making you guys see all the videos because this is a lot of picture and you guys won't remember this. But only for the ones which is extremely high yield, I will show you the videos because I do not want you guys to forget those ones. Okay, that's what we're going to do. Cryptococcus neoformans, one of the most highest yield fungi ever. So please put your attention to the video and make sure that you take everything. And don't forget this, if you can master this video, you can master a lot of questions from Cryptococcus neoformans because they mention a lot of high yield stuff over here. Okay. Is there anyone who can help take a picture?
Welcome to section 10.
Dr. MS, are you willing to help us out by taking a picture of this? Okay.
Of fungi. This is our fungi overview figure. In this video, we'll be discussing Cryptococcus neoformans, which you can see right here. This scene will take place in a crypt underneath a religious cathedral. If you look closely, you can see several coffins with mummies inside. In any case, the word crypt sounds like Cryptococcus, so this image is all about Cryptococcus neoformans. Now you can see that we've added a woman to the image. She is the priestess who is in charge of this crypt, and she likes to spend her time drawing because this crypt can be kind of isolating and depressing for her. Notice that she's holding a religious staff with 2 balls on the end that are separated by a narrow stalk. The 2 spherical balls represent budding yeast, and the narrow stalk in between the 2 balls should make you think of narrow-based budding. So Cryptococcus neoformans exhibits narrow-based budding. I introduced this idea in section 2 of fungi, but let's briefly review it again here. When yeast cells divide through budding, they most commonly form a stalk like this, and then a second yeast will form off of the stalk like this. This type of budding is referred to as narrow-based budding. So Cryptococcus is no exception and exhibits narrow-based budding. Now, if we zoom up, you can see that we've written 5 to 10 micrometers on one of the coffins, which is to help you remember that Cryptococcus is approximately 5 to 10 micrometers in length. Also notice that she's drawing an angel with an ink pen, and that there is a little halo on top of the angel's head. The ink is a reference to the India ink stain, and the halo should help you remember the clear halo seen in the stain. So Cryptococcus can be identified using the India ink stain, which will show a clear halo surrounding the pathogen. This is an image of Cryptococcus using the India ink stain. You can see little black circles, for example, right here. This represents the central part of the pathogen, and surrounding these circles are clear halos, for example, right here. These halos form due to the thick capsule present in Cryptococcus. If we return to the image now, notice that we've shown a pigeon sitting on a pipe. You can see some pigeon droppings falling to the ground on a dirty floor. Together, these ideas are here to help you remember that Cryptococcus is found in soil and pigeon droppings. Next, notice that we've shown a medical examiner guy bringing in a dead body. This is a crypt after all, so it makes sense that dead bodies are being stored here, right? Anyway, if you look around this body, you can see a bunch of dust flying into the air, which is being inhaled by the medical examiner. This is here to help you remember that Cryptococcus is acquired through inhalation. Unfortunately, this crypt is kind of falling apart. We've got a pigeon infestation on one side and sewer pipes breaking on the other side. Notice that some of the urine is spilling onto the ground below. Hopefully you recall from our bacteria chapter that the pool of urine represents urease. So Cryptococcus is urease positive. Again, we covered this test in our bacteria videos, but recall that the pink color in the test tube right here indicates that the organism is urease positive. Now you can see that we've shown a Bible next to this religious priestess, and she has opened it to a page that says, "Keep the Sabbath day holy." The word Sabbath sounds like Sabaro, and it's here to help you remember that Cryptococcus can be grown on Sabarodextrose agar. This is an image of Sabarodextrose agar. You can see little colonies of Cryptococcus forming on the agar, for example, right here. Now we've added another body bag being dragged into this crypt. I'll zoom up on this so you can see it better. Notice that this dead person is in a red sack. This is a symbol for the capsule, because the bag is surrounding this dead body, just like the capsule surrounds the center part of the pathogen. Also notice that there are music symbols nearby from the organ that you can see in the background. The word music sounds like musicarmi and should make you think of this stain. So putting all these ideas together should help you remember that Cryptococcus neoformans can be identified using the musicarmine stain, which reveals a red capsule. This is an image of the musicarmine stain taken from the lung. You can see a prominent red circular shape, for example, right here, and this represents the inner layer of the capsule. Now, if you look closely at the girl carrying this bag, you can see that she's wearing latex gloves. These should make you think of the latex agglutination test. In this test, you mix latex beads with a sample of interest. The beads are coated with antibodies that detect the capsular antigen. So if the sample contains Cryptococcus, then the latex beads will clump together as the antibodies bind to the capsular antigens, and this is known as agglutination. So in summary, the latex agglutination test can be used to identify the polysaccharide capsular antigen. Because this is an antibody, it's more specific and sensitive than other tests. Now let's turn our attention to the medical examiner guy and discuss some of the clinical features of Cryptococcus. First, notice that he's bringing in the body on a stretcher. This is our symbol for a compromised immune system. Next, you can see that a large Band-Aid was placed on top of the bag and it says 50-year-old male. The Band-Aid should make you think of AIDS, and the 50-year-old male reference should make you think of a CD4 count of 50. So putting all these ideas together should help you remember that Cryptococcus commonly causes disease in immunocompromised patients, such as AIDS patients with a CD4 count less than 50. Like I mentioned earlier, the dust is going up near the medical examiner's face, causing him to cough. The cough itself should make you think of a lung infection. However, symptomatic lung infections are uncommon. It's most important to know that Cryptococcus is aerolized and that the primary site of infection is in the lungs, but most of the time patients are asymptomatic. If we look back at the priestess, notice that she's wearing an intricate-looking religious hat. The hat is our symbol for the meninges. So we've included it here to help you remember that after establishing itself in the lungs, Cryptococcus can disseminate to the meninges through the blood and cause meningitis. Next, notice that we've shown another guy off to the right who is cleaning one of the coffins. Notice that he's getting his head covered in the urine that's leaking from the pipe up above. The head getting drenched like this is our symbol for encephalitis. So this is here to help you remember that Cryptococcus can also cause encephalitis. Also notice that there are a bunch of bubbles on top of the coffin. We've included this to the image to help you remember that imaging may reveal soap bubble lesions in the brain. Alright, now let's finish up with treatment. If we zoom back up on the priestess, notice that she has a flute and a sigh on her back. Flute sigh sounds like flucytosine. So flucytosine can be used to treat cryptococcal meningitis. Next, notice that she's wearing an intricate-looking religious shawl with the letter A on it. This is to help you remember that azoles, such as fluconazole, can be used. Finally, notice that the priestess has been busy with her artwork and finished a picture of a frog off to the left. The frog, or amphibian, is here to help you remember that amphotericin B can also be used.
Okay, Dr. Emmons, were you able to take a picture? Okay, so that's great. Thank you. Okay, so was this video helpful or not? Was this video helpful? Yes or no? Okay, so let's look and see if we have covered everything. They have more information than that. What's written over here is that Cryptococcus neoformans, they are 5 to 10 micrometer with narrow budding. They're heavily encapsulated yeast, but they are not dimorphic, meaning that they do not survive in the cold and as a mold, nor in the heat as the yeast. So they're not dimorphic. They're found in soil and pigeon droppings. The source is high yield. They're acquired through inhalation with hematogenous dissemination, meaning that they're acquired as respiratory droplets. Okay, respiratory droplets. That's how it's written in UWorld, respiratory droplets. They're highlighted with Indian ink, which shows a clear halo. This picture is very indicative of Cryptococcus neoformans. Okay, that's that. And you have mucicarmine stain, which will show the red inner capsule. This is also high yield, the mucicarmine stain. Either you can do Indian ink, which will show a halo, or you can do a mucicarmine stain that will show the red inner circle. You can also do a latex agglutination test to detect the polysaccharide capsule antigen, but it's also more sensitive and more specific. If you do a scan of Cryptococcus, this Cryptococcus is more responsible for causing meningitis. Especially, this can cause meningitis in immunocompromised individuals. For example, patients with AIDS are more prone to get Cryptococcus infections, not immunocompromised by antibiotics, means severe immunocompromisation due to AIDS, for example, or HIV. You can get cryptococcal meningitis. If you have cryptococcal meningitis, which is a fungal infection, you can get lymphocytes over there, okay? Lymphocytes or neutrophils, and then your fluid, your opening pressure will either be increased or normal. Okay, count will be lymphocytic. And if you do a scan of the brain, then over there you can see that there are soap bubble lesions in the brain. Soap bubble lesion. The treatments are not being focused on right now. We'll focus them in the future. But if you have to focus it, then Cryptococcus treatment is very specific, meaning that you cannot give any and every antifungal. It will not work. That's why we will only give amphotericin B and flucytosine. Flucytosine and amphotericin B. This combination is given for Cryptococcus neoformans. Are we clear about this, Cryptococcus neoformans? Yes or no? Are we clear about this? Yes, what is your question? Please ask the question. If needed, unmute yourself and ask the question. Narrow budding. Narrow budding means that, so broad-based budding is, for example, if this is a fungi, this will produce another fungi by a broad budding. Okay. Narrow budding is something like this, and they will produce an extension, and they will produce another small fungi, and this fungi will later grow bigger, and then once again it will bud again, and this small type of budding is known as narrow budding. Okay, this is narrow budding. Are we clear? Can we begin with mucor and rhizopus? Okay. Now, let's begin with mucor and rhizopus. Mucormycosis and rhizopus, they are very common for one type of patients. First and foremost, you have to locate what type of patients are more common for having mucormycosis. I'm not sure. Okay, there we go. Diabetic ketoacidosis. Patients with diabetic ketoacidosis are extremely extremely at risk for having mucormycosis. This fungi, this takes advantage of high blood sugar and the keto acids to grow. Basically, they are irregular, broad, non-septate hyphae with branching at wide angles. If I tell you that it's a septate hyphae branching at narrow angles, which fungi am I talking about? Septate hyphae branching at narrow angle, aspergillus. And this is broad, non-septate hyphae branching at wide angles. Please focus on this one. They were responsible for causing mucormycosis. Then it's more common in diabetic ketoacidosis, and then after that, it can also happen in leukemic patients, but diabetic ketoacidosis is more common. Inhalation of spores. Once again, it's a respiratory droplet infection. That's the source. The fungal will, after it enters, the fungal will enter the blood vessel, penetrate the cribriform plate, and enter the brain. Okay. So what will happen is, for example, if this is the patient, right? This is the brain, this is the eye, this is the nose. The fungus will enter through the nose, enter the brain through the cribriform plate, and then they will go and deposit over there, causing frontal abscess or rhinocerebral abscess. They're also responsible for causing cavernous sinus thrombosis. If they cause cavernous sinus thrombosis and cavernous sinus, which cranial nerve is more likely to get affected first? Fast answers, please. Which cranial nerve is more likely to get affected? No. 7 is not the one. Right. 3, 4, 6, V1. Very good. Okay, 3, 4, 6. These are the ones which says in the cavernous sinus. Out of 3, 4, 6, if I ask you once again, which nerve is more prone to get affected? Okay, sixth cranial nerve, because it's the longest cranial nerve, cavernous sinus thrombosis. Patients can also have headache, facial pain, or necrotic eschar on the face, like this one. Okay, this is also a presentation of mucormycosis, necrotic eschar on the face. Treatment is surgical debridement and amphotericin B. Okay, surgical debridement and amphotericin B. Basically, questions are usually going to come with the appearance of the organism. The appearance of the organism is a non-septate hyphae with with wide-based budding, wide angle budding. Okay, okay. Are we clear? Can we begin with pneumocystis? Okay. Last two fungi for today. Pneumocystis jirovecii. Pneumocystis is responsible for causing pneumocystis pneumonia. This is an interstitial pneumonia, and pneumocystis pneumonia is more common in immunocompromised patients. Most infections are asymptomatic, but they are more common in AIDS patient and predisposed to a disease, okay, which predisposes to a disease. Pneumocystis pneumonia, one of the most common types of chest X-ray presentation is bilateral ground glass opacities with pneumatoceles, as you can see over here, ground glass opacity. Okay, there's ground glass opacity, as you can see in this chest X-ray, and although this shows interstitial pneumonia, but this has a more ground glass appearance like presentation. And over here, you can see the pneumatoceles. These are the pneumatoceles. Okay, and you can diagnose pneumocystis by taking the specimen. Your specimen is bronchoalveolar fluid or bronchoalveolar lavage. And when you take the bronchoalveolar lavage, do you remember that what type of stain do we do for pneumocystis? What stain do we do for pneumocystis? Silver stain, very good. What other or organisms can we stain with the silver stain? H. pylori, Legionella, and Coccidioides. Okay, don't forget that. So our specimen, if we think that the patient has pneumocystis pneumonia, what is our specimen? I just said the name of the specimen. Which one do we take? Do we take blood? Do we take feces, urine? What do we take? Bronchoalveolar lavage. Very good. So we take the bronchoalveolar lavage, we do the silver stain, and after we do the silver stain, we see disc-shaped yeast. The yeast is shaped like a disc. Disc-shaped yeast is seen on silver stain. Treatment is TMP SMX, pentamidine, and dapsone. TMP SMX, pentamidine, and dapsone. These are the treatments. You can also treat it with atofacone. They start prophylaxis when the CD4 count drops below 200. So when the CD4 count drops below 200, that's when the patients are more prone to have pneumocystis pneumonia. So the things to look out for pneumocystis pneumonia is also high yield, especially in immunocompromised patient. For meningitis, it's cryptococcus. For lung infections, it's pneumocystis pneumonia. Once again, pneumocystis pneumonia is it's a yeast-like fungi that can cause ground glass opacities with pneumatoceles and diffuse interstitial opacities in atypical pneumonia. The specimen is bronchoalveolar lavage. After we take it, we will do silver stain. And after we do silver stain, we will see disc-shaped yeast, as simple as that. Treatment is TMP SMX and pentamidine. We'll talk about the treatment later, but that's all you have to understand about pneumocystis. Are we clear about this? Yes or no? Okay. Last one. Last one is Sporothrix schenckii. Very easy to understand. I'm going to tell you why. Sporothrix schenckii, this is responsible for causing sporotrichosis. And the thing is, this fungi, this looks like a cigar. That's the most important and interesting fact about this fungi. That this looks like a cigar at 37 degrees Celsius, like this. Okay. And what happens is, this is also called Rose Gardner's disease. I'm going to tell you why in 1 second. So let's see what this is. This is sporotrichosis. It's a dimorphic fungi, meaning that it can stay mold in the cold and yeast in the heat. It exists as cigar-shaped yeast at 37 degrees Celsius in the human body and as hyphae with spores in the soil. They live on vegetation. When spores are traumatically introduced into skin, typically by a thorn. So basically, you have rose gardeners or gardeners, especially when they are, for example, cleaning the garden, they're taking out thorns and everything. If they get stuck by a thorn, then there's a possibility that they can get infected with Sporothrix schenki. The thorns have the fungi over there. They can cause local pustule or ulcer. And what happens is once the fungi they enter by the pick of the thorn, that they can disseminate with the help of the lymphatic drainage. That is that they call lymphangitis, ascending lymphangitis. And this is more common once again in immunocompromised hosts. Always remember, fungal infections are more common in people with messed up immunity. Okay, so that's that. So it's more common in immunocompromised hosts. The treatment is itraconazole or potassium iodide that we can give over here. And for sporothrix, just think about a gardener while gardening, they get pricked on their hands by by a thorn, and that thorn is the source of infection or introduction of the fungi. And once it enters, it can ascend upwards by ascending by infecting the lymphatic duct, and that's how you get Sporothrix schenki. Okay, visualization is it's a dimorphic fungi, so you will see mold in the cold and yeast in the heat, and that yeast in the heat at 37 degrees Celsius, it looks like a cigar. That's all you have to remember. Okay, so with that being said, we are successfully done with mycology. Are we? Yes, we are. Okay, so we are done with mycology. Okay, so how do you guys feel? I personally, for one, feel really great that I could help you guys finish bacteriology and mycology in one day. Can you repeat with the cigar? Cigar is basically, this is the shape of the Sporothrix schenki at 37 degrees Celsius. This is how it looks like. This has a cigar shape. This looks like a cigar. It's shaped like a cigar, like a cigar. That's all. Okay. So what are you going to do when you guys are done with the lecture today? What are you guys going to do? Revise. Not revise, you have to read and memorize. Okay, that's why you are not expected to do any questions in these 5 days. In these 5 days, you're only expected to master microbiology. Please make proper use of this time and do exactly how we ask you to, because this will really help you. Trust me. Stay away from questions for a while, because now is not the time to do questions. You can do microbiology questions full blown when you are done with microbiology, because you cannot separate questions on bacteria, fungi, and parasite. So don't do questions right now. Just try to master this by learning exactly what we have underlined. Okay, the questions are going to come accordingly. So that's that. First and foremost, are you guys happy that you guys are done with bacteria and fungi, though? Yes or no? Is that something to be happy about or not? Okay. So that's that. Okay. So with that being said, we could not revise bacteriology today, but we did finish bacteriology and fungus. So tomorrow, before or after we are done with the lecture, can we do the revision on bacteria and fungi? And tomorrow, let's hope to finish parasites. Yes or no? Okay. Before? Okay, we'll try to do it before. Tomorrow, first thing in the morning, I was thinking of starting with viruses before we start with parasite. Do you guys think that would be a good idea? Okay. Before we finish parasite, virus is actually pretty big. So let's finish virus first, and then let's jump to parasites. Okay. I will try my best to finish virus in one day. Okay, but learning about the virus in one day, that's actually a lot of information. I'm not really sure how far I will succeed, but I will try my best. Okay, I'll try my best to finish viruses in one day. Okay, so with that being said, can we end our lecture over here today? We're not going to do questions for this week because we will give you extra time to memorize all the informations. Is that a good idea? Okay, so the only reason we are not doing you world questions right now and doing another hour of the lecture is because we want to give you that extra time to rest and start memorizing the microbiology. Okay, so with that being said, can we end the lecture over here today for now? Okay, so hope you guys had a great lecture and understood most of the high yield stuff. Please don't forget to do your homework, learn the microbiologies. Please don't skip out on the homeworks because there's absolutely no point in doing these microbiology classes if you're not putting in work at home. Okay, so make sure you do the homework. We'll test it out tomorrow before we start the lecture. We'll start our lecture tomorrow at exactly 9 a.m. in the morning, so please don't be late. And with that being said, we'll try our best to finish microbiology this week, and hopefully we will succeed. Hope you guys have a great day. Thank you so much for making it to today's lecture once again. I'll see you guys tomorrow. Have a great day. Bye-bye.